My dear respected brothers and sisters in Islam, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. So alhamdulillah, we got two great programs lined up for you today, inshallah. But before we get into that, we just thought it would be good to speak about healthy Ramadan, as Ramadan is fastly approaching, as well as a COVID-19 update from both perspectives, a male perspective as well as a female perspective. So we broke this program into two parts. The first part will be from a female perspective and an update for COVID-19. And then after Maghrib Salah, 8:15 sharp, inshallah, we'll have another doctor join us and speak about the male perspectives of healthy Ramadan. So inshallah, just before we get into it, I just want to reiterate a couple things. For Makkah Islamic Center, we have our food bank going on. So alhamdulillah, it's been very successful. 30 families, about 22 students, international students that have been taken care of, alhamdulillah, by your donations. So we urge, especially going into the month of Ramadan, that we help give non-perishable foods to Makkah Islamic Center where we can help those in need, not only before Ramadan, but throughout the month of Ramadan, until we get past this COVID-19 situation. So inshallah, please reach out to any one of us, as well as you can reach us on our social media platforms to help donate. Second is Makkah Islamic Center launched an app, so you can find it on the Google Play Store, as well as the Apple App Store. So please download. Inshallah, it's going to be very informative throughout the month of Ramadan, so you can stay tuned for more updates, as well as you can see those updates live on your app. So without further ado, we have Dr. Uzma Syeda joining us today. She's a medical doctor, an MD, in our own community here in Toronto. Alhamdulillah, after receiving her MD degree from Sabah University School of Medicine, Dr. Syeda went on to pursue family and community medicine. Dr. Syeda is a board-certified family physician here in Canada with the College of Family Physicians, CCFP. And she also is certified in the US with the American Board of Family Medicine. So on your screen, you'll see Dr. Syeda. First and foremost, Sister, Assalamu alaikum wa rahmatullah. We appreciate your time for joining us today.
Wa alaikum assalam. Thank you for having me.
MashaAllah, I appreciate, because I know it's a hot topic right now with this COVID-19. And we've always been doing healthy Ramadan. So, especially in the Indo-Pac, pakore and samosa, etc., is very, very famous. So we want to stay fit throughout the month of Ramadan. And our sisters urged us last year to get a female perspective. So we only thought it would be fit for you to come, because your noble father, Sayyid Nematullah Shah Sahab, has a lot of taluk with us, so we thought it would be good from a female side to bring you on board. So again, I thank you very much.
Thank you.
So we'll jump right into it. Yes?
Yes, we can get started. So yes, it is going to be a bit challenging during Ramadan with the ongoing pandemic, but with the right information, it's very possible to complete both aspects. Maintain your safety, at the same time have a healthy Ramadan. I would just like to start off first by talking a little bit about the updates on COVID-19, and then I'll kind of gradually get into the specifics about Ramadan and kind of healthy eating and how we can manage some chronic conditions while fasting in Ramadan, like diabetes, high blood pressure, and then of course questions. So starting off with COVID-19, we know we're all in a global pandemic with this virus. So there's some things that we all should know in all communities to practice safe physical distancing and social distancing. I always get asked the question, what are the symptoms of COVID-19, so that I can identify myself? The thing with COVID-19, what makes it really tricky is it's like a respiratory illness, just like the common cold or the flu. So you're looking for symptoms like fever, cough, sore throat, runny nose, and headaches. And those are the general symptoms. Now, as we get more data coming in recently, we realize that there's a lot of cases of COVID-19 where there are just digestive issues. So people can present with nausea, vomiting, diarrhea with a fever, and may not actually have any respiratory symptoms at all. So those are the key things to look into, knowing what are the symptoms. And of course, initially when we started with this pandemic, the cases were very much travel related, airports, and coming from areas which were initially the hubs for COVID-19. But as we know now that we have a lot of community transmission, so having that history of travel is very important for two reasons. One, because if you've traveled outside the country anywhere within the last 14 days, you are required to stay home. This is like a mandatory quarantine here in Canada. So that's very important, whether you have symptoms or not. So if you recently came back from India, Pakistan, anywhere, Iran, Wuhan, China, regardless of your destination you're coming from, you have to quarantine at home for 14 days, regardless of symptoms. That's a really important point to bring across, because we have a lot of people who've recently come back and they feel fine. Look, why don't I go out and run the errands for everybody from the house? But that is not the way we will be able to control this pandemic. And knowing how the situation is, we have to be a global citizen. And for that, we do need to adhere to all practices that the local public health agencies, lay out for all of us. So that's number one. Number two, travel history is important, because if you present with these symptoms and you have a travel history, then it raises a suspicion that maybe the cases or the symptoms you're having could be related to the COVID-19 virus. So we talked about the symptoms, we talked about its relation to travel. The next thing that I would like to talk about, and this question comes all the time, is who gets tested? Can I get tested? I'm really nervous. I have a runny nose, and I heard so and so, coronavirus. So that's a very good question, and I would urge everybody to, inform yourself so then you can better understand. The government of Ontario has a very good self-assessment tool. You can just go to their website and click on it and just go through the questions, and they will tell you exactly what you need to do and whether or not you would be a candidate for testing. So it asks you basic questions that we talked about, which are the symptoms. It asks you about your travel history, and it also asks you if you're a healthcare worker, frontline healthcare worker, or if you've recently traveled. So the self-assessment tool is really helpful because it gets all this information into perspective, and it tells you what your next step should be, so you're not guessing. So at the end of this tool, it will either tell you to contact your family doctor so that they can tell you what to do, or if you don't have a family doctor, if you don't have access to one, you can call Telehealth Ontario. They have a toll-free number which everybody can reach out to, and they will connect you to a nurse and then possibly a doctor as well. So that's really important. But in a nutshell, most cases of COVID-19 are self-resolving. They're mild, just like the cold, just like the flu. So if you have any of those symptoms, most cases, if you just self-isolate yourself, get rest, drink lots of fluid, and take like Tylenol for fever, most symptoms could be managed at home. You do not need to go out and get tested. You do not need to reach out for any help unless you need it. That's number one. However, if you have a medical condition such as diabetes, high blood pressure, kidney disease, any respiratory diseases such as COPD, bronchitis, severe asthma, any immune deficiency due to some medications you take, like chemotherapy, cancer patients, or any comorbid condition which could potentially make you higher risk to get complications from COVID-19, you definitely should reach out to your family doctor or Telehealth Ontario, and you may be a candidate for testing. And the reason why in these special populations, the rationale for testing is because if you're having symptoms, severe symptoms, and you have these comorbidities, by doing a test and getting the confirmed diagnosis, you might be eligible for certain experimental treatments and clinical trials that are ongoing at this point. So it's more to test and identify those patients who are going to be, one, high risk for complications from COVID-19, where it might not resolve at home within a few weeks, or those patients that are frontline healthcare workers, such as your doctors and nurses, who, if they have COVID-19, then they need to have extra safety precautions in taking care of patients. They may have to be removed from their work for a certain amount of time to control the infection spread, or they might be able to need access to a very good amount of personal protective equipment if they're in an area where there is no alternative and they must keep working. So the test is kind of reserved to identify, those individuals. But for most people, if you have a fear that you have COVID-19, somebody that you heard had it, it is not advisable to walk into ER or any clinic or asking for a test. In today's time of physical distancing, it's recommended that before you go to any medical facility, whether that be your local clinic at your family doctor or any walk-in clinic or any testing facility, it's advised that you call ahead and let them know. Then they will advise you whether or not you should come and also advise you how you should come, whether you should wear a mask or not, and which entrances you should use. The goal is to kind of contain the infection and infected people as much as possible. And in terms of treatment, we talked about the symptoms. Now we'll go on and we talked about who should be tested. Now, just a little, I don't want to get into the details, but just to briefly, how do we test for COVID-19? It consists of taking a respiratory nasopharyngeal swab. So it is like a Q-tips, and the doctor or the medical practitioner that's testing will insert it into your nose and upper throat and get a good sample of your secretions and some cells, see if the virus is there. So the test can be uncomfortable, but that's the way we're testing right now. Currently, there is no vaccines available, unfortunately, at this time for human use for the novel coronavirus or COVID-19. We have several trials that are underway in many different countries, and the World Health Organization is working with that to develop one. It would be a great help if we had a vaccine that was available and everybody we could vaccinate, and we would be able to, contain this pandemic, but we don't have a vaccine at this point. And there is no proven medications at this point that we are regularly using to resolve COVID-19. Like I said, if you're one of those high-risk groups and if your health is reaching, deteriorating and you're hospitalized, there are some experimental trials that your doctor, treating physician will speak to you about and may consider, as some drugs early on have shown some benefit. But it's definitely something that we're all working on and trying to see what we can do to understand it better.
All right. So a lot of information, a lot of good information, and some of the questions that we already received, you kind of answered it. So it might be a little bit repetitive, but I guess it's still a concern nonetheless. So if somebody wants to get tested out of the fear, so let's say they wake up one day and they got a little sniffle, but it might not be anything. It might be the regular flu or whatever. Can they be tested? And if so, if we are testing, where can somebody go? Can they go to their family doctor to get tested?
Okay, that's a very good question. I kind of touched on this a little bit, but I think it's really important to emphasize again. So first thing you do if you get the snuffles or the common cold is you can, number one, go to the Ontario self-assessment tool and answer those questions, and they can tell you what to do next. Or the general rule is if you feel snuffles or if you're unsure about what's happening, call your family doctor or call Telehealth Ontario if you don't have one, and follow the advice of your doctor. Generally speaking, if you have a mild illness, general sniffles, a little bit of a dry cough, and you're still doing fine, you will not be tested unless you are in a specific high risk category or you have other things the self-assessment tool identifies you, such as recent travel history, close contact with a COVID-19 patient. Generally, though, out of fear, if you just want to make sure I don't have it, we do not test for that because we're trying to utilize the resources we have to where they're needed the most. And in a pandemic, just like toilet paper and food, testing resources are actually very, very important as well.
You make a very good point, because nowadays it's just you get the minorest thing and everyone wants to get tested, right? So I appreciate the answer. And two questions, one for the female side. I guess it's a two-part question. If a sister is pregnant and one, she gets COVID-19, how much harm can be done to the child? And then let's reverse that question. If she's pregnant, how can she stay safe?
Really good question because pregnant females we kind of put in a special category and we talk about special precautions. Good news in this matter, I guess I would say we have some good news with COVID-19. There's no evidence to show that pregnant women, number one, are at a higher risk. So they have the same risk as the general population. And number two, there is no evidence currently that there is, mother to child transmission of COVID-19 during childbirth. So if you are pregnant, the best thing that you can do to prevent COVID-19 infection is the same thing that everybody should be doing. Number one, stay home. And this is such a simple principle and it cannot be emphasized enough. Whether you are well, whether you are sick, whether you're pregnant, whether you're not pregnant, the best thing that you can do for yourself, for your baby, for your family, for your neighbors, and for your country is to stay home. If you don't go out, you don't expose yourself to germs and you're not taking your own germs out there. And second thing, frequent hand washing. So whenever you come back home, or even if you're in the house, you were just out in the yard, you're out back, wash your hands. You want to wash your hands with soap and water for at least 20 seconds, or use alcohol-based hand sanitizer if you are not near soap and water. So staying home, number one. Number two, wash your hands, and also frequently clean most frequently touch surfaces and disinfect them as often as you can. So your countertops, your doorknobs, your cell phones, stuff that you normally touch, you want to disinfect and keep clean. Third thing is physical distancing. That is trying to keep a good amount of distance between yourself and other people if you have to go outside. If you're in your house and you're with the people you live and you are in your bubble, you can stay together. But when you go out and staying home is not possible, for example, you have to go to your doctor's office, you have to go to the pharmacy to pick up your medications, you have to go do your groceries every 2 weeks. That's when you go out and practice physical distancing. I do want to clarify one point because you see a lot of people saying, as long as we practice physical distancing, we can go out and do all the usual leisurely activities. That is not the case. Physical distancing is only when you have to go out due to a necessity. Otherwise, you should be staying home. So physical distancing, when you go out, you want to maintain a 2-meter distance between you and the next person, 2 meters or 6 feet. And you want to practice a basic cough and sneeze etiquette. So you want to make sure that you're coughing or sneezing in either a tissue that you have, or if you don't have a tissue, you're going to use your elbow sleeve and you're going to cough or sneeze in your elbow. So that's very, very important to protect yourself and to protect other people if you have to leave the house. And the third thing is you want to avoid touching your face. Do not touch your eyes, your mouth, or your nose. We all have this habit of, moving our hair, touching, our scarves, our face, but you have to kind of retrain your mind not to do that, especially right now where, you could be touching surfaces that may have the virus because community transmission is so high and you could touch your face. And the last thing that I would recommend to stay safe is using a face cover. Now, this is a kind of a controversial topic. Initially, when the risk was really low, we said, general public do not have to wear a mask, and we just reserve it for healthcare providers. But now the World Health Organization and the Centers for Disease Control in the US and even Health Canada recommend that if you have to go outside, you can, if you would like, wear a homemade or self-made face mask that covers your nose, your mouth, and does not leave any gaps in between. And you can put it behind your ear or behind your head. And it doesn't have to be any fancy material, anything as long as it covers, liquid from going in. You can now use a self-made mask when you go outside to protect yourself in cases where physical distancing might not be possible. You're in a grocery store, you're trying your best. Maybe the pharmacy you're visiting is small. In cases where even after trying your best, physical distancing might not be possible, we're recommending to wear a face mask or a scarf or a bandana, anything you would like over your nose and mouth. But overall, the best and most important thing you all can do, and the general public can do, and pregnant women can do, and non-pregnant women and men can do, is to stay home.
I think that's a great answer, because nowadays what we find is, and maybe you can clear this misconception with us. They said as long as you wear gloves and as long as you wear masks and you use hand sanitizer, you're not going to get COVID-19. Can you just shed some light on that briefly?
Mm-hmm. So we can't say any, form of protective equipment that we make or use 100% prevents COVID-19. Yes, it drastically reduces your chances, but it's important to use these, protective equipment as a means of last resort. So, like I said, if you can't stay home, if you have to go, yes, you can wear a mask. Yes, you can wear gloves. Yes, you can use a hand sanitizer. Yes, you can frequently wash your hands. You can avoid touching your nose, mouth, and eyes. So, all these things do decrease your chances of getting COVID-19. However, it does not mean that because we have these protective guidelines, we are going out unnecessarily and using these for leisure, because we're human. There is always room for human error. You might not know the way that you're removing your mask, you accidentally might touch your nose, might touch your face. The way you're you might remove your gloves and throw it out, but you touched your cell phone 3 times and you forgot to disinfect your cell phone. So all these precautions you can do to help, prevent COVID-19, but you have to understand nothing is 100%. So you don't need to engage in non-essential things and put yourself at risk just because you're certain that you made this bandana mask or you're going to wear some gloves.
No, that's very good, because nowadays, there's that misconception. So I'm glad you cleared that up. Before we move on to the healthy Ramadan side, we just got some questions for some of the viewers, and our engineer Hafiz Yahya has been sending them to me, so I'll ask those questions, and then
Sure.
we can see how much more comes in regards to COVID-19. But I promise you, there's going to be a lot with the healthy Ramadan, especially for the female side of you. So the first question, are there any dietary restrictions for those diagnosed with COVID-19?
There are no dietary restrictions for those diagnosed with COVID 19. We just recommend getting good nutrition, ample amount of rest, and lots of hydration with fluids, whether that's juice, water, a combination of them. There's no specific foods or specific diets that are shown to improve outcomes with COVID 19 or to prevent COVID 19, unfortunately, at this point. So, if you are diagnosed with COVID 19, follow general guidelines that your doctor always tells you. Have three good, hearty meals. Take your multivitamin. If you normally take multivitamins, drink lots of water, get your amount of sleep, and try to isolate yourself so that you do not spread your infection to other people. So there's no need to make any special dishes or to have anything specific. General things for the immune system you're welcome to do. So you want to have, vitamin C rich foods like oranges, orange juice, you're welcome to have that. You want to get your, normal calcium, vitamin D, zinc, but nothing specific to COVID 19.
Awesome. Do health products, sorry, the next question, do health products which are marketed as immune boosters, do they give any sort of enhancement of protection to COVID 19?
So that's a little bit of a general question because, first of all, we need to know which health food product we're talking about. But I do understand the general question. So, readily available over the counter supplements that are promoting themselves as immune boosters usually have some combination of a vitamin C, zinc, some herbs to kind of boost immunity. There's no harm in taking them or incorporating them now to strengthen your immune system, but it does not give you any added benefit that you can, stop practicing the precautions we talked about, like staying home or practicing good hand washing or hand hygiene.
Awesome. I guess people are just trying to find ways to kind of combat this because we've never seen this before, obviously. So there's a lot of mixed messaging. So thank you for clearing that up. And
Yeah,
then I think,
like there's so much information on the internet, and for somebody, especially in the period of when you're staying home, when you have some free time, what do? You Google. You're seeing the statistics going up every day on TV, and you're Googling what I can do to help myself, help my family. So there's a lot of myths out there, but unfortunately nothing is confirmed at this point to give an added advantage besides, hygiene and social distancing and staying home.
nice. What is the best practice to take care of elderly parents who have a compromised immune system?
That's a really good question. So, if you have elderly parents, elderly patients that you're taking care of, or anyone elderly in the house you're taking care of, the best thing that you can do for them, to them, is prevent germs from reaching to them. So, number one, try your best to see if they can stay home. Somebody else who is not elderly can go get their medications and their groceries. So, keep them home as a priority. And also, people that are visiting them, limit the number of visitors. So, even if five healthy people go out and come back and meet them, even though those patients may not get sick, they can still pass on their germs through contact to the elderly population and make them sick. So, the best thing you can do for them is to keep them safe and isolated, especially if you're above the age of 60 and 70. It's recommended that you self isolate yourself regardless of whether you have symptoms or not, and try to see if somebody else can, deliver you your groceries or essential services.
That's a great answer. I think we just got to take time to think before we do something. I think that's the best way.
That is a good way to think about it. Because so many times you want to do things that are so helpful, but in this case, you have to kind of think like, the act that I'm going to do, is it going to help them or hurt them? Your intentions might be great, but we have to look a little bit more into the science as well.
That's great. So, Alhamdulillah, we have a lot of viewers watching. But I guess they're anticipating the healthy Ramadan perspective from the, the sister side. Even our the sisters in our family, they're gonna tune in. So I told them, probably 7:30. They want to get rid of some I guess.
COVID-19 is important, so they should tune into the whole thing.
No, absolutely, absolutely. So, sister, first thing I want to do before we get into healthy Ramadan, I want to, from our team, thank you because you are a frontline worker and you are putting your health at risk for the greater good. So, from Makkah Islamic Center and Sufi Council of Toronto, we want to thank you for doing what you do day in and day out.
Thank you.
All right, so healthy Ramadan.
Okay, healthy Ramadan. One thing I do want to say just before we enter Ramadan is, thank you for those kind words, but one thing that everybody can do if they want to show their gratitude to their doctors, to their frontline workers, to the essential workers. And this is not just healthcare providers. This is your, food delivery, your meal delivery, your medication delivery. Is if you want to show gratitude and if you want to be thankful, you have to do your part, which is to stay home. Because if they're going to work for you, they have families as well. You need to stay home so that we can get over this pandemic sooner rather than later.
Absolutely, beautifully said. So, sister,
Okay.
healthy Ramadan. I'll turn it over to that, and then obviously we already have some questions lined up as they're coming in. So I'll let you start, and we'll do the same thing about question and answers, inshallah.
Sure. So the first thing about Ramadan is just understand that this Ramadan might be a little bit more challenging than usual. So, we have our usual, suhoor, iftar, ibadat, everything that we do. But at the same time, we have to respect the local restrictions that are placed by the public health authorities. And we have to be a law-abiding citizen and do our best first to help with that as well. So this Ramadan is going to, present us all with different challenges. Our local mosques will not, might not be open maybe for the whole month of Ramadan for congregational prayers. Jummahs canceled, 5 daily prayers canceled. At least at this point, no mosques are operating, excepting we're all doing, webinars and live feeds through the internet. So that's one aspect. Taraweeh prayers are affected. You're not going to physically be going in, and it's hard to say exactly, but we don't even know at this point if Eid prayers are going to be happening on a large basis in terms of congregation. And so just, I know it's healthy Ramadan, and we will get into the nutrition, what I should eat, what I shouldn't eat, and, how can I maintain my health, my weight and all that. But you have to understand that in the middle of a global pandemic, there are going to be a little bit more challenges that we do have to kind of maneuver around. So going into like healthy Ramadan, especially for females. So the advice that I give today is going to be mostly applicable to everybody, males, females, but I am going to touch on some topics which are specific for females. First and foremost, I think just general things, tips for a healthy Ramadan is doing a few things such as meal preps. So it's very easy as soon as you're breaking your fast to go open the fridge and try to eat everything in there. Especially you think, oh, now with COVID-19, whatever I have, or for suhoor, you want to just, open the fridge and eat whatever is there. So it does take a little bit of an effort, but if we do some meal prep, that would really help because you can pay attention to what your meal is and what you are incorporating in your meal. So if you are talking about, suhoor, you want to eat foods which are going to, keep you full for a longer time and which are going to, keep you hydrated for a longer time. So you want to eat, carbohydrates that are slow releasing, and you want to eat a lot of fiber for suhoor. So things like cereal, oatmeal, whole wheat roti, whole wheat bread, whole wheat pastas, yogurt, fruits and vegetables. Those things are all going to be good options rather than eating plain white rice or high sugars such as noodles, to keep you full for longer and also to kind of keep your energy levels going as well. In terms of hydration, it can be especially challenging in Ramadan to get, your daily intake of water. Generally, we recommend drinking anywhere between 8 to 10 glasses of water a day, which equates to about 2 to 3 liters of water per day. So you need to prep yourself. So it all comes under planning. Plan out what proportion of that water are you going to be drinking at suhoor, and what proportion of that water you're going to be drinking after iftar. A good way to tackle this is, get yourself a water bottle or a jug. And I personally utilize this because otherwise it's very hard to keep track. You might drink 2 sips of water at suhoor, 2 sips of water after your iftar, because you're so busy with trying to fill yourself with food because, rightfully so, you feel like you've been fasting for all day. So I think a lot of it, you need to plan out your meals, and this doesn't take the whole day. You need to maybe sit, men, women, children, everybody can sit and just plan out for, 5-10 minutes what we're going to have for iftar and what we're going to have for suhoor, especially in times with COVID-19. We might have to get a little bit creative. We might have to finish up all the food that you have and get creative with what recipes that you're going to be making, because we want to limit the times we go to the grocery store. One person can go once a week or once every 2 weeks and get the essentials. So definitely meal prep is important. Second thing, like I said, keep track of your water intake. And the third thing for Ramadan is to incorporate exercise. So it's very, very common for women, especially when they feel like their workload is increased in Ramadan, because they might be having whatever their day job and kids, and then they still have to prepare for iftar, or even men who help prepare for iftar. Everybody, it's extra challenging because you have to not only be fasting yourself, but you have to prepare for iftar, and then you can't go out and make a quick run for milk and eggs. You can't go out and make a quick run every day for some things that you might need for a recipe. That's where the planning comes. So sit for about 5 minutes or so in your day and just plan out what exactly you're going to do, and not only plan out your food, but make sure you get exercise as well. So you're probably asking me, like, when do you want us to fit exercise in Ramadan, because we have so few hours between, iftar and suhoor. But it's really important that you maintain, especially those patients who have diabetes, high blood pressure, heart problems. They need to make sure that they are getting their regular amount of exercise, because they need to avoid, number one, gaining weight from just sitting, eating, and sleeping. And at the same time, you want to keep all your joints and your body healthy and your heart healthy at the same time. So simple things that sisters can do, and anybody, elders and men, can do at home is, just go up and down your stairs if you're able to safely do so. Make a couple flights of stairs, after Maghrib prayers, after you finish your iftar, and as you're waiting for Isha, as you're waiting for Tarawih. I know, we all reach for, our phones, TVs, and other sources of media, but, while you're doing all that, just doing a few flights of stairs, if you're physically able to, maybe just utilizing your living room and your foyer to take a few rounds, walking back and forth. It can be simple things. It doesn't have to mean that, you have to have a big home gym and everybody has to go on the treadmill or elliptical. I mean, if you have those facilities, great, utilize them, encourage others to utilize them. But staying active in Ramadan is very important, in addition to planning your meals, especially for sisters, because they might be so busy taking care of themselves, their families, their kids, their iftar, that they're not getting any time for themselves, and they end up maybe just eating a lot right after you break your fast for iftar, and then eating for suhoor, and then just sitting in between those two meals, either doing their ibadat or just utilizing TV or media. So that's really important. One thing for sisters I would like to add in terms of food is trying to incorporate iron-rich foods in your diet, especially during Ramadan, where it's very common to get fatigued, with all the work and fasting. As women, we know that we have our, monthly menstrual cycle and we do lose blood, so it's very common in women to have iron deficiency. And one way to combat that is to increase iron in our diet. So you can eat, if you are a vegetarian, you can eat green leafy vegetables such as spinach, broccoli, and kale, which have high iron content. You can also eat lentils and legumes. And if you are non-vegetarian and if you enjoy meats, you can get iron from red meats, and you can get iron from liver as well if you are one that eats liver. Other than that, you can, and if you're not sure what's available for your diet, and if you're not sure how much iron you're taking in, women can reach for a woman's daily multivitamin. It doesn't really matter what brand, as long as it says woman's multivitamin, there should be iron content that is slightly higher and should provide you enough for your day.
Wow, a lot of information. So the questions are coming like crazy. Hopefully, we have enough time to kind of get through them all. So the first question, a sister, I'm not even getting into my questions, but first question that came in, I fast during the month of Ramadan and I lose a lot of weight, but I pick it up right after Ramadan is over. How can I prevent that?
Okay, that's a good question. What are you doing that you're losing so much weight in Ramadan? That's, think about that. Even though that might seem, we're saying this as a joke, but reflect on why you lost weight in Ramadan. Maybe you were eating, portion meals. You weren't binge eating, you didn't have the opportunity to eat all day, so you were more mindful about what you were eating, and you only ate two times, and maybe with a snack. And so basically reflect on what you did in Ramadan. In Ramadan, we incorporate a lot of good habits, not only for ibadat, reading the Quran, fasting, being more regular with our salah. We try to do the best that we can for our deen in Ramadan. And so just like how we should reflect, all the good things I was doing in Ramadan, let me try to carry that on throughout the year in terms of ibadah. We should do the same thing with food and weight loss. So if you were eating smaller portion meals and you were more active during Ramadan and less sedentary, and you ended up losing weight just by eating less and being more active, then you should try to continue those after Ramadan so that you don't regain the weight. So if you portion your meals for a good amount of time, your metabolism is going to catch up and eventually evolve. So you won't not need to eat more, and you won't get this cravings to eat more. So just like the good ibadat habits that we pick up during Ramadan and that we should strive to continue for the rest of the year, reflect on what you did that made you achieve a healthy weight and try to continue those same eating habits and exercise that you did. So if you had, a portioned good iftar, good suhoor, and a healthy snack, and had three good meals, and you exercise a little bit, then maybe that's all you need. Maybe you don't need to have 6 meals a day and go have more junk food, and just allow food to be a reason for socialization. So just be mindful of what you did, and it's very possible to continue those good practices. So the short answer to that is reflect on what you did and continue it.
MashaAllah, very good answer from both sides, deen and the dunya. So thank you for that. Another sister is asking, while fasting, if someone has thyroid condition, when should they take their medication if it requires to not take any food for 30 minutes?
That's a really good question. So thyroid medication is one of the medications which is very important to be taken on an empty stomach. So if you're on thyroid medications, usually called Synthroid or levothyroxine, a good time to take it is when you will not have food in your stomach within roughly about an hour surrounding when you take the medication. So the best time, in my opinion, that you should take it is right before suhoor. So, for example, if you get up to pray tahajjud, or if you just get up a little bit earlier than suhoor, you want to take your thyroid medication. And by the time you finish whatever you need to do, whether that is prepping for suhoor, whether that is catching up on some missed prayers, whether that is praying the Quran, whatever you need to do, you're going to, cover that 45 to an hour of not eating anything, and then you can have your suhoor and then start your fast. That is one option to do. I think that's the time that you can have nothing else in your stomach as well. The alternative to that is you could potentially do it, at iftar as well. If you wanted to, you could take, after you break your fast, you would have to really kill your appetite. If you'd have to just take the thyroid pill and break your fast with water and not eat anything for an hour. Hour is the maximum. Usually anywhere between 30 to 45 minutes is also reasonable as well. But being humans, it's very hard when everyone else is eating and breaking the fast. You're just saying, I had my thyroid pill, so I'm not gonna have iftar now. So definitely a time to consider taking it would be right before suhoor.
Awesome. Very good answer. I guess we're getting a lot of diabetic questions, so I'm going to try to sum the 5 or 6 that I got. Not from a religious standpoint, because that's not what we're discussing, but if you are diabetic, should you fast during Ramadan? And if so, how would you recommend doing so? I mean, I can answer that question religiously, but from a doctor's point of view.
Sure. So if you're diabetic and if your diabetes are controlled well with medications, and you have a good diabetic plan with your doctor, then yes, you can fast in Ramadan. Medically as well, you should be fine. You just have to discuss with your doctors when are the best timings to take your medications, and what meal planning you should do, and which medications you can continue, which medications you should stop. You could have that discussion with your family doctor and be prepared. But yes, if your diabetes is controlled and you have that discussion, then you can fast in Ramadan. Of course, there are cases where patients who are not doing well, patients whose diabetes are not controlled at all, patients that are having episodes where their sugar drops really low, that they're fainting, that they need hospitalization. Of course, you can talk to your doctor and you will realize that even religious point of view, you will be exempt from fasting if you're not safely able to do so. But most people control diabetes. You discuss with your doctor in advance your medications, your meals. You should be perfectly fine to be able to reap the benefits of fasting.
Very good. Going back to thyroid patients, what foods are good for thyroid patients in the month of Ramadan?
Okay, so there's just like COVID-19, there's not really any specific foods that are good for patients who have thyroid problems. Iodine is one supplement which our thyroid gland uses to make our own thyroid in the body, but we get that from salt. So most commercially available salt. In the old times when salt wasn't iodized, patients did not get iodine in their diet, and they were developing, swollen thyroids or goiters, and they were needing medical treatment. But generally now, considering that our salt is commercially iodized, as long as that's part of your diet, you should be fine in terms of what you can do. Of course, if your thyroid is not functioning well, your doctor, you will need to go and they will have to give you blood tests and medications. But otherwise, as long as you're having some iodine in your diet, either from your salt or from the food that you eat, you should be fine.
Awesome. The question that came, so a sister is asking, she tries to make it healthy meals for their family, but they love their samosas, pakoras, etc. How can I, or what would you recommend I guess it's a two-part question. Is the style of cooking for Ramadan? So I guess the family is watching, so they want to hear you say that pakoras and samosas are not not healthy. But what can we provide to kind of keep the same desi style, but I guess still make the family happy and be healthy at the same time?
So I guess the short answer to that is everything in moderation is okay. So, that's again where meal prep comes in. So occasionally you can indulge yourself and your family in, some fried foods, whether that is pakora, samosas, whatever you like. Occasionally have it as part of some of your iftars, but the key is, keeping in mind moderation and any specific dietary requirements your medical conditions tell you. So for example, if you have a high cholesterol diabetes problem, then you will need to be more careful and consume less of those fried goodies, whereas somebody who doesn't have those conditions, they could maybe have one or two more than you. But I think the key is in moderation and also keeping track of what medical conditions you have. So you can definitely enjoy it occasionally. And it's all about setting good examples. So if you know in your family you have a lot of diabetic patients and cholesterol patients, you want to make sure you don't, have that every iftar. You want to maybe kind of try to have it, as part of a few iftars.
That's good. Especially in our family, it's it's very common and amongst all families in from the Indo-Pak area. So I guess just cut it down and try to give different options as well. So two questions, just time permitted, because I do want you to wrap up and give a general overview and kind of final words. So I'll cut it down to the last two questions. Sister is asking, would I eat food with higher or lower glycemic index? Glycemic, sorry.
So the answer is, so glycemic index refers to how much glucose a certain food will break down in your body. So again, the answer to this depends on number one, whether you're diabetic or not. And number two, what exactly does your day-to-day activity consists of. So foods that have high glycemic index are foods which break down into uh, a lot of sugars, a lot of glucose. And foods with low glycemic index, they don't have that much glucose. So if you're not a diabetic and it's not a big concern for you to keep your sugars in strict control, you always want to keep your glycemic index to match your activity level. So you can incorporate both foods with high glycemic index and low glycemic index. And if you're a diabetic, you want to reach for foods which allow you better sugar control. So you can incorporate, again, both types of foods, but you might have to reach for foods that don't have a high carbohydrate load.
Awesome. So the last question is in terms of high blood pressure. Sister suffers from high blood pressure, constantly gets headaches. What would you recommend is the best way to combat this during the month of Ramadan?
Mhm. So high blood pressure can cause headaches. So if you're experiencing frequent headaches, it's a good idea to get your blood pressure checked. Whether you have a machine at home, you can test that. And or headaches could be completely unrelated to blood pressure. So the key is first, I guess, talking to your doctor and finding out why the sister is getting these headaches. So if they are related to blood pressure, then some things that can be done in high blood pressure patients in Ramadan is trying to control their salt intake. So it's very, very common at the time of breaking the fast to kind of eat as much as we can. And we try to eat our entire day's worth of food in kind of between iftar and dinner. So we're intaking a lot of salt as soon as we break our fast. And that can raise blood pressure. And then you can get a headache for the night and for the evening. So again, you want to prep meal prep your meals and portion them out and try to decrease the salt intake. So you want to try to cook food that has less salt. I know it's hard, it kills the taste, and some people just cannot sacrifice that. But especially with high blood pressure or even heart failure patients, you need to really watch your salt and also make sure that you're taking your blood pressure medication. So in Ramadan, people might think that I'm not going to be eating, my blood pressure is not going to go high, I don't need to take medication. This is not true. You have to talk to your doctor about what medications you're on and which ones you can continue while fasting and which ones you might have to put on hold. So I guess the answer to the for sister is, try to decrease salt intake and talk to your doctor to take your blood pressure pills on time and the right way so that you do have your usual medications working.
Awesome. So, sister, that's I guess it's a lot of information. So now I'm going to give you the difficult task of wrapping it all up. And then I would like at the end, when you are done, just to for the viewers, where your clinic is, how they can reach the clinic number, etc. Because just for view, we will share your business card online as well. But just after you're done wrapping up, if you could just tell them where they can find you and how they can get to your clinic, that'd be great, inshallah.
Sure. So, I'm going to try to, both topics are huge. So, COVID-19 and Ramadan. So, nutshell, what I would say in terms of COVID-19, to protect yourself, protect your families and everybody, try to prevent it as much as possible. Right now, like we said, we don't have a cure. Most cases of COVID-19 do resolve on their own, but people with comorbid conditions or other medical conditions can have a very severe course of the disease. Complications like pneumonia, kidney failure, and even death are possible. So to prevent all that, the best thing to do for everybody, not only healthy people, because healthy people can pass it on to, seniors who are not so healthy, is for everybody is to prevent it. So if you don't get COVID-19, then you don't have to worry about it. And the best thing we can do right now is to stay home and prevent the spread of germs and practice good hand washing and cough and sneeze etiquette. And if you're noticing any symptoms, please self-isolate yourself. If you're in the same house with other individuals, keep a room to yourself and self-isolate yourself in that room until you're better. Then you can come out and self-isolate yourself in your home away from other people, and good hand washing. So the take-home message from COVID-19 is to prevent it, and preventing it by staying home, get good hand washing, and isolating yourself when you're sick, or isolating yourself regardless if you've traveled anywhere for 14 days. And in terms of Ramadan, I would say, brace ourselves. It is going to be a little bit more challenging Ramadan as we all try to make ends meet in terms of, having our, meals, getting them regularly through the groceries and meal preps, at the same time not having the opportunity to go for congregational prayers, for Taraweeh and all that. So it is going to be challenging, not only physically but mentally as well. But we just have to focus and do the best that we can with what we have, and do everything with a good intention and follow the guidelines of your doctor, follow the guidelines of your public health authorities, so that you can have a safe Ramadan and a healthy Ramadan, and hopefully, control the pandemic so that we're able to, if not celebrate this Eid, at the mosque, future Eids that are to come, future Ramadans that are to come. So, and be a little bit mindful of, the nutrition and exercises in Ramadan. It's very easy to forget about everything and throw it out the window, but be a little bit more mindful of what you're eating and whether you're getting exercise or not.
MashaAllah. So, Dr. Uzma, thank you very much. Again, from our team, we wish you a couple things. Wish you and your family stay safe. Have a blessed Ramadan. And thank you very much for being a frontline worker, putting your life and your health, etc., on the line for the greater good. We appreciate your time. Thank you very much.
Sure. Thank you for having me. And like you requested, you can, I have a clinic, a Guildwood Medical Clinic on the east end of Toronto in Scarborough, right in the Guildwood community. You can find me online, Guildwood Medical Clinic, and my phone number and everything is there. So if anybody would like to reach out or need any help, they're welcome to do so as well. We are currently doing virtual visits, and we are seeing some emergency cases as well. So we have resources that are available. You can visit the website, you can give us a call, and you can reach out to me at Guildwood Clinic in East End, Toronto. Thank you.
Thank you very much, Dr. Uzma. Please stay safe and remember us in your du'as, and we wish you much success in your clinic as well.
Thank you so much. Assalamu alaikum.
Wa alaikum salam. So, dear viewers, this was Dr. Uzma Syeda, mashallah, enlightening us about the update for COVID-19, as well as Healthy Ramadan from a female perspective. A lot of information, so I would suggest that we share this video, rewatch it before the month of Ramadan starts, as it's going to, inshallah, start next week. So, again, I just want to reiterate, Guildwood Medical Center, Dr. Uzma Syeda, the number is 416-238-8135, 416-238-8135, and the address is 3775 Kingston Road in Scarborough. And if you want to visit them, like she mentioned, online to book virtual appointments, etc., you can do at guildwoodmedical.com. guildwoodmedical.com. So I hope the sisters enjoyed the program. So thank you very much again for Dr. Uzma Syeda for joining us. Alhamdulillah, we wish them much success in the future, and hopefully we can connect again as we get through this pandemic, inshallah. So, Samayin, we're going to have, now we had Dr. Uzma come in to talk about the female side. Inshallah, after Maghrib Salah at 8:15, we will have Dr. Muffaqam Shah joining us to talk about the male side of Healthy Ramadan. So, inshallah, please stay tuned for that. Until 8:15, we will meet again. Jazakallah khair. Wassalamu alaikum wa rahmatullahi ta'ala wa barakatuh. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الصلاة والسلام عليك يا سيدي يا رسول الله وعلى آلك وأصحابك يا سيدي يا حبيب الله. My dear respected brothers and sisters in Islam, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. MashaAllah. So we had our first session, Alhamdulillah, with Dr. Uzma Syeda, now from a female perspective. And inshallah, we have our, he's not new to the Sufi Council of Toronto, Alhamdulillah. And me personally, I've known Dr. Muffaqam Shah for many, many years. So, and they have been a great part of building awareness for healthy Ramadan for the last 3 years, Alhamdulillah. So, I'm going to talk about a couple things before we get started. As usual, inshallah, the month of Ramadan is very, very close and it's upon us. During this time, we ask that you open up your hearts for the less fortunate. We have here at the Makkah Islamic Center, we have a food bank that, alhamdulillah, we've been giving, especially during this pandemic, to those in need. About 30 families, about 22 students, international students who need non-perishable food. So please donate generously non-perishable foods to the Makkah Islamic Center so we can help these families through the month of Ramadan. You can message us on all social media platforms to get in hold of any one of us, Mohsin Patel, myself, Hafiz Yahya, Hafiz Bilal, and our elder brother Amir Qadri Saab. So please donate generously. And then Makkah Islamic Center, for the launch of Ramadan, we ask that you download our app, Makkah Islamic Center, on the Google Play Store as well as the Apple App Store. And inshallah, we have a lot of initiatives, especially for the youth during the month of Ramadan, as well as daily quizzes, daily nasihas. Ulama from all over the world will be joining us through the month of Ramadan. So please stay tuned and connected with the Makkah Islamic Center. You can find us on Facebook and Instagram, and you can always Sufi Council of Toronto on all social media platforms to stay connected through the month of Ramadan. Inshallah, Dr. Muffaqam Shah was born and raised in Markham, Ontario. He was a former YMCA lifeguard and swimming instructor. MashaAllah. He graduated medical school of Deccan College of Medical Sciences from Hyderabad, India. Some of his accolades during the time include graduating with honors, mashallah, in the first division and receiving the gold medal for the highest marks in general surgery, mashallah. He completed clinical clerkships in both primary care radiology and neuroradiology, respectively, from Harvard Medical School and the Yale School of Medicine, mashallah. He is a registered medical practitioner certified by the Telangana State Medical Council in India. He is currently working as a preventative telemedicine consultant, as well as working towards securing a medical residency position in the field of diagnostic radiology. He's given multiple talks, interviews, etc. at this alma mater institution about the importance of effectiveness of nutritional therapy for managing obesity, diabetes, gout, and other lifestyle diseases. So without further ado, on your screen, Dr. Muffaqam Shah. Assalamu alaikum. Dr. Saab, how are you?
Walaikum salam, doing well. Thank you for having me.
MashaAllah, I appreciate your time. I know it's a crazy time right now, especially with the pandemic. So thank you very much for taking the time to join us today, and as usual, join us every year to build awareness for healthy Ramadan.
Absolutely, my pleasure.
So Dr. Saab, we'll get right into it. I know we're going to have a lot of questions, just like we've always had in the masjids that we've done the last 3 years. So I guess we'll kind of do it in two parts. The first part, just a general, your perspective of what's happening with the COVID-19, the prevention, to build awareness, social distancing, etc. If we can kind of talk about that, and then we'll open up the channels for questions. So I urge the viewers to ask questions, and Dr. Saab can kind of answer on his perspective. So we'll talk about that, and then we'll cut it in half, and then go towards healthy Ramadan, inshallah.
Sure thing.
So I'll turn it over to you.
Okay. So as far as the COVID-19 situation that we've had we've all been going through together. It is something new that we haven't experienced as a community or as a society, at least in our lifetime. And I feel that for the most part, we've been doing well. We've been, for the most part, following Health Canada's guidelines to our best of our ability. We've been keeping up to date with the new developments. We've been making sure to check in on people. We've been trying to keep our health in check. So give yourself some credit. Everyone's been doing well compared to what we've had to deal with. But as far as what we can do better, because we do still have some ways to go, right? Before we can actually be on the downward trend and be done with a lot of these measures. We have to continue what we've been doing and build on those good, positive changes that we've made. So, as everyone knows, the most important thing is definitely the physical distancing aspect of it. So, making sure that we do stay the 2 meter radius apart from people around us, making sure that you practice very, very good hand hygiene, coughing and sneezing hygiene, as well as the main aspect, which is taking care of your health. Like, this is the perfect time to take an audit of what you're bringing into your health, what you're cooking, and what you're actually putting into your bodies. And is that helping you in your health, or is that making it harder for you to possibly fight these infections? And so I think there's a great opportunity for us to actually, build on the stuff we've already started, and then hopefully um, uh, take it further and actually go towards preventing anyways from getting this disease. Or even if we do get it, give us ourselves the best possible chance of recovering from it and fighting it and actually coming out on the other side stronger and healthier.
Well, mashallah. So, Dr. Saab, just from your perspective, if you can stress the importance of social distancing, as well as safety measures and precautions that we can take to kind of bend the curve, let's say.
Mm-hmm. Yeah. So I thought about this a lot, how I wanted to tell people. And I feel like the best way is to kind of explain to them exactly what's happening around the air around them. Because everyone has been hearing 2 meters apart, physical distancing, social distancing, and we've heard it time and time again, right? But if someone actually understands, what the reason for this is, then I think it would make their lives a lot easier in actually implementing those changes. So what we really need to do is that you can think about people around you. Of course, when we talk, when I'm talking right now, when we sneeze, or even when we're just around someone, we're all releasing some sort of particles from our mouth. It's very, very minuscule. It's on the microscopic size. You won't see it. You won't even feel it. So if you can imagine that every time you talk, every time you're in a vicinity of someone, they're releasing something from their nose, from their mouth, and other places. So if that is going on and it is falling onto surfaces, falling onto food, falling onto doorknobs and any other surfaces that we touch, our cell phones every single day, and then someone else touches that, because this virus does live on various surfaces for prolonged period of time, be it 4 hours to almost up to 72 hours on certain surfaces. So if you're touching those things and not washing your hands again and bringing it into contact with your mucous membranes, which is our eyes, our nose, our mouth, things that are in contact with our bloodstream, then all of a sudden you've given it a route to get in, right? So if you can just think, the reason why we wear a mask and the reason why we want to keep far from everyone else is that even if someone were to kind of, disperse those droplets that have some virus in it, you're minimizing your chance that you'd ever come in contact with that, either through the direct route or even if it were to fall on something, through you actually touching and bringing it in. So you're greatly reducing the risk by practicing these measures. So if you think of it that way, it makes a lot more sense why we're not told to stay indoors and not really go outside, not meet our closest family and friends. There's a reason behind all that, right? So if someone understands that, it makes it a lot more simple and much more easier to follow the recommendations rather than someone saying, "Oh man, why do I have to do this? I don't want to be cooped up inside all the time. What's the point of social distancing? I know that person, he's healthy. There's nothing he could have happened," but you don't know who's come into contact with who, or not even what surfaces they touched, right? So for the betterment of everyone, understand the reason why we're doing it and how it's going to help you, right, to stay safe, because everyone wants to keep themselves and their families safe. So I think by putting it that way, people are much more likely to follow these guidelines.
Mashallah. Dr. Saab, the biggest thing that we get, I guess, from the news, etc., we don't hear it from the likes of doctors like yourself.
Hmm.
they are the general, you know, runny nose, the cough, the temperature. But we're also hearing on the news that sometimes you don't know if you have the symptoms. So it gets hard to kind of defeat this disease, I guess you want to call it. So
Hmm.
what measures can we take to kind of prevent all of this from happening?
Right. So as far as prevention wise, I think it's a couple of um, categories, right? So we already talked about the physical distancing as well as the hand hygiene, coughing hygiene measures, and then now we can bring it more towards the actual health aspects of what you can do yourself to actually um, prevent yourself from this infection because it doesn't discriminate old or young, based on color. It's all about the way it gets in, right? So the way this virus gets in is that it'll use some sort of tissue that we have for our nose, our eyes, our mouth, and it'll burrow in to those receptors and it'll be able to infect. And all a virus wants to do is just to replicate. That's the only thing it knows. It wants to replicate in that cell, and as once it's full, it bursts that cell and it keeps replicating. So then the symptoms that we experience are basically our immune system fighting it off. So people experience, vague symptoms such as fevers, headaches. They have muscle pain sometimes, a sore throat, a cough, a runny nose, and sometimes people have diarrhea. As you can see, as I'm listing this out, these are such varied and general symptoms that, like you said, people are not sure if they have it or not, right? So what they can do is that, of course, you still have to follow, Health Canada's guidelines as far as if you do feel like you have it, then of course give your primary physician a call, as well as even reaching out online to be able to take a small self questionnaire to see if you qualify for testing or if this even is possibly, the novel coronavirus. So those are obviously things that you should do. But as far as people worrying, do I have it and do I not know? We will see some symptoms, right? There will be some kind of indication because, like I said, the virus is doing something, right? It's getting into those certain cells, be it in your throat, in your nose, or in the lung tissue, and it's replicating, right? And those cells are somewhat, getting destroyed, and the immune system's coming in to try and help it fight it. So there will be some symptoms. You're not going to be sitting around, lounging and say, "Do I have the virus or not?" You'll have some sort of indication. It might take up to 14 days to be able to notice them, but they will come. There will be some symptoms, and so I can probably dispel the myth of that. If you've been, for the most part, following the proper measures and you've been staying relatively healthy, staying away from most people, and you're sitting at home and you feel okay, then you most likely are going to be okay. And of course, keep monitoring yourself, right? But the anxiety and the fear of do I have it and will I not even know, that can be dispelled. There will be some symptoms that will show up.
I guess the $1 million question, Dr. Saab, is why isn't there a vaccine?
Yeah. No, so I was just reading up right before this talk. I was making sure that I could be right up to date so I give the best information to everyone. Is that at the moment, the WHO is conducting a mega trial, which is essentially instead of having like one or two drugs that they're going to follow and see if they're going to be effective, they're putting all of these different various interventions all at once to see which one would be able to help us. And they're also, it's fluid. So they're making sure to change it or add in new stuff or bring in different things. So it's all ongoing. But the way with the vaccine works is that even if they've, identified the DNA and they've made the vaccine, we can't just give it to 30 million people in the entire world unless you know it's safe, right? And that takes time because you have to give it to a certain small group of people who might have been infected to see if they've actually, recovered. And there's a certain procedure. It's not just like political or any kind of like red tape or any kind of like bureaucracy that's involved in like why it's taking so long. There is actual, scientific reason because you have to give it to actual people. You can't give it to mice or rats and hope it'll transfer over. You got to give it to real people, and they have to see actual results, and then you have to quantify the results, make sure that okay, if everyone got this vaccine, the people who have it would hopefully be prevented. People who don't have it also prevented. So you have to make sure that it's the right one, right? Before you can just give millions of people a drug that might be harmful. So that's the main reason why. But as far as interventions that are being done, probably seen tons of fake news as far as this will help or that will help. But do know one thing, that if you were to get it and you were to go into the hospital and you were to be treated for it, there are interventions being done, right? They're not just going to leave you alone and hopefully hope for the best. There's always, constant talk between medical professionals, and they're getting the latest guidelines, and so they're trying different medications and to see, who's getting better, because this coronavirus. It's a genetic has genetic similarity to the original SARS virus that happened. So that's why we call this SARS CoV-2, right? Because it's similar. So we do have some stuff that is similar, so we can try different things, and it is working somewhat, right? But it's not enough to say, you know what, this is a drug that's perfect for this, and everyone can start taking it. But know for sure that if someone were to get it, there are interventions being done, and people are on certain medications that are working, and they're trying different things. And there's the results, and all that stuff is going again into studies and into the mega trial to be able to say, you know what, we have this much data that this many people received this medication and it worked, and then hopefully, down the line we'll be able to use that to recommend, the proper treatment. But for now, stuff is being done, but there's no one vaccine or one medication that we can recommend that say, this is preventative for the SARS-CoV-2 at the moment.
MashaAllah. So I guess we just have to be patient. And here, another question one of the brothers asking is, why the 14 days? What's significant about 14 days?
Sure. So 14 days is more so what we've seen in the literature and the scientific papers of the sort of the max limit of when symptoms have been shown. And it's a range, right? So it's not necessarily up to 14 days or always 14 days. It can be 4 or 5 days, 7 to 6 days, right? It depends on the person's immune system and how it reacts. So someone whose immune system who is relatively like very pro-inflammatory, a lot of stuff can be released all at once and they'll feel symptoms, right? Someone who has a not so great immune system, it takes more time for it to mount an attack on those viruses, and so it might take longer for them. Again, there's no quantifiable measure to see who's gonna develop them when, but what has the 14 days that we've got is from the literature, from China, from the previous cases where you've seen the range, like the wide end of the range is the 14 days. And we've also seen, some more outliers, of course, like the crazier numbers. But as far as the ones that are more so, in our standard deviation, you'd say 14 days is the one that you can say up to 14 days you'll have seen some symptoms. Before that, it is possible that people can be going around who are asymptomatic. They're fine. It's still the virus is still replicating, the immune system is still mounting an attack against it, and they feel fine for the most part, right? So that's why we have to practice all these measures where, like, even if someone isn't coughing or someone isn't, symptomatic, you're not sure if those tiny droplets are falling on something or if they're coming around and you're bringing it into you. And so that's the reason why we mentioned the 14 days to tell people, you know what, even if someone is asymptomatic, they could possibly still harbor the virus. So it's more a precautionary a number.
MashaAllah. I guess I'm going to put you on the spot here a little bit. To the best of your knowledge, are we bending the curve? Are we getting better, or do you think, in your professional experience and your opinion, professional opinion, how far, if you had to make an educational guess? I guess you're not putting a stamp on this, but I guess that's the top. When is things going to get back to normal?
Yeah. Yes,
kind of your perspective.
That's probably the $1 million question, right? Is when can we all get back to normal? So I think definitely what we can look at is the daily counts that we're getting from our health authorities of the new number of cases that we have, the number of recovered that we have. So based on that, we can see, and we're plotting it every single day, and we've seen an uptick, and now we've, for the most part, have seen a steadiness, right, in the number of new cases. We're not saying that we haven't seen new cases. We're saying that the number of cases that we're seeing are for the most part staying steady. And so if you make a graph, you can see that graph has kind of started plateauing. And hopefully after the plateau, we do see a fall. And so that's what we're all hoping for. And so we can look at other countries that have had similar situations, the numbers that we've had, and similar infrastructure changes that we've had, health measures that we've had, and we can look at them to make an estimated guess to see, okay, we're probably like 2 weeks or 1 month behind this country or this region. And so we could for the most part, it's still day by day because you don't know how many people are getting tested. It's not like it's a numbers game, but it's still humans are still involved. And so what we have to do is monitor every single day and see when do those cases, the new cases, start dropping slowly, and we're plotting. And then we know, okay, we're past the plateau, we're probably on the downtick, but we have to make sure that we do our part and keep doing these measures, because that's what's going to keep that thing going, the line going down. If we were to say, you know what, okay, fine, there's only 300 new cases today, awesome, we're on the downtick, and we all go out and stop, practicing physical distancing, then we're going to see that rise again, right? Because the reason we have all this drop is because we're all being so diligent and doing our part, and we have to continue that. But we can definitely look at other countries and make an educated guess and hope that we follow the same trajectory. But it depends, right? It depends on how people are going out and how many people are interacting. So it really does depend on us, right? So we've seen in models that people have made with algorithms that if you have like a very, very tight amount of social distancing or physical distancing, then it can take this much time. So it depends on us. If we are very, very strict with our measures and our adherence to this, then we can hopefully be back relatively uh, soon. Is what I'm gonna say. I'm not gonna put a time on it, but relatively soon. It's if we're able to contain ourselves.
No, mashallah. It's very, I mean, we get the question asked all the time is when is things going to get back to normal? So we just got to continue doing our due diligence, and inshallah it will get
Mhm.
better. Dr. Saab,
Inshallah.
if you were to, because everyone I guess is, another question just arrived, so I'll go to that, and then inshallah we can go into, I guess, where everybody is waiting for is the healthy Ramadan part. So
Mhm.
the question a brother is asking is, once a patient is affected by COVID-19 and they are cured, is there possibilities that it may come back or relapse?
Yeah, it's actually a very good question. I was just reading up on this, and we've seen data from other pandemics we've had, the SARS or the MERS viruses, wherein um, patients who have had the viruses, they've got the disease, and of course, their immune system has been able to fight it for the most part, and then the symptoms that they have are dissipated, and they feel better and they're discharged for the most part, right? But you have to, again, I think it'd be a lot better if I told people the way these things work is that that virus, when it enters those cells, it's replicating in the millions, right? So all these different cells, and it's containing, in the immune system, of course, is containing it. The symptoms we really feel are because of our immune system trying to attack it, trying to clear this thing out, right? So once it's kind of kept it at bay at a certain point where it's not really causing too much harm to the immune system, and the immune system doesn't have to mount a huge attack on it, that's when those symptoms start going away, right? So again, if you were to swab someone who's already been cleared of coronavirus and you swab them again, which I don't know why you do because you don't have that many tests, but if you were to, which people have done in other countries, you might still find it positive, right? Because it might still be in those cells. However, it might not be at such a huge level that is causing the immune system to mount an attack on it. You might have antibodies in our system that are able to fight that. So as far as like being the actual swab positive, yeah, it is possible, and it is happening. But as far as the actual like disease that you feel from it, the symptoms that you feel, once you've kind of passed that phase, we've seen from most of the data that the antibodies are forming, and it's being kept at bay. And we need more data. We have to see a year down the line, are we still going to see virus particles inside of those cells? Is it going to be something that's going to happen seasonally every single year? Will it be something that you have lifelong immunity to, like some viruses, right? Because all of them act a little bit differently. So because it is a novel coronavirus, we're still learning every single day about certain things. But again, the general principles or the laws of immunology and the way our immune system works, that still applies, right? For all the viruses. That's what we can apply for here, and gives people that, what, once you've got the symptoms have cleared, you should be okay. We'll keep, we can still monitor them if people have issues later on down the line. But as far as someone going out there, getting coronavirus, and then going through the symptoms, and then all of a sudden getting it all over again. We need more data to see that, but we have seen some results where people do have antibodies. So, but only time will tell when people who have been infected are possibly reinfected, and then we'll have to see if those antibodies are helping, or are they not as effective. But at this moment in time, there's studies that are ongoing that are answering that exact question that this viewer has, and only time will tell.
I guess it's a very good answer because it's still new to all of us, right? So I can only
Hmm.
imagine how new it is to obviously the medical field. So, Dr. Saab, if you were to wrap up, kind of in a general overview, your kind of message to the public about COVID-19, if you can do that for them, and then we'll inshallah go into healthy Ramadan.
For sure. So the general message I wanted to get out there to everyone with this platform would be that, again, we've done a tremendous job so far in actually being able to change the way our society works and the way we do things day to day for the betterment of everyone else, right? We've already taken, such a selfless act as an entire country. So we have to continue doing that because it is working. We've seen that the cases have steadily started to plateau off. And if we wanted to eventually drop off, we need to continue these measures and maybe even be a little more stringent with them, right? We shouldn't jump right away into, you know what, it's a month and a half, it's too much for me to handle, time to get back to regular life. Regular life will get back as soon as we're able to actually, bring these cases down to a point where our healthcare system isn't so extra burdened. And so it's on us. So that's one thing I wanted to say is that keep doing what we're doing. We're doing the right things. Take it day by day. You don't think so much, you know what, I'm only going to get back to my regular life once all this stuff is done. This is a great opportunity for us to, expand our knowledge, expand our other interests, and actually, take this time to be with your family. It's a great blessing in itself, right? For some people. So take it day by day. Don't live your life waiting for 2 months or 3 months down the line. Live it right now. Whatever in whatever way we can. Live it and be happy and hope for the best and take your measures. Take your protection, and after that, leave the rest to Allah subhanahu wa ta'ala. Believe in the qadr of Allah. Don't be so paranoid. Don't have so much anxiety. Anxiety, mental health is a big issue right now for every single household. So, yeah, so definitely, take it day by day. Secondly, I wanted to say is, of course, this is segueing into the healthy Ramadan part, is that this is a great time to take care of your health and to get your body in check and to be able to be in the best position to be able to possibly fight this virus. It's a great opportunity for us because we're all, for the most part, cooking our own home meals and not eating out as much. So a lot of the other stuff that the excuses that we had before for a relatively bad diet are kind of gone now. So it's a great way to start learning how to cook, start learning about nutrition and how it affects your body, how it affects your health. Start trying to if you have those chronic diseases that you've had for many years, start trying taking the steps to try to hopefully reverse those diseases. And again, this is the great segue into the next segment that we have of healthy Ramadan.
MashaAllah. Dr. Saab, I think, you know what, I've benefited. I might not have stick to the diet, but I've over the years, listening to you, it's kind of encouraging the way that you give this next, I guess, lecture, you should call it, or teaching session, because you have done so much of this in regards to obesity, diabetes, gout, etc. I think that the highlight of what you're going to talk about is the sunnah foods. So I guess we're gonna exactly what you said, the segue into healthy Ramadan. The questions are gonna come already. We had viewers already message us in regards to healthy Ramadan. So I will turn it over to you to kind of talk about your thing, and we will jump in as we have been, like the COVID-19, and discuss how we can kind of become more healthier during the month of Ramadan, inshallah.
Absolutely. So this Ramadan is unique in the fact that, again, we're all able to finally put away a lot of the distractions and the other things that would cause us to maybe not fulfill Ramadan in our best capability, right? Both in a spiritual sense and in a dietary sense. Wherein the dietary sense, wherein we'd have, parties or get-togethers, or we'd have, dinners or huge gatherings where if the host is going to feel bad if I don't indulge in the food they serve me. That's all gone. Those excuses are all gone now. And then again, with the spiritual sense, it's an amazing opportunity for us to really focus on our own ibadat, on our own connection with Allah subhanahu wa ta'ala, right? wherein, again, of course, the sense of community in the masjid was amazing, and everyone yearns for that. But this time we have the opportunity to just connect one on one, and just better ourselves, right? Spiritually as well as emotionally as well as physically. So it's a great opportunity. Don't think of it as like, you know what, oh man, no tarawih, there's no, iftar dawats. What's the point of Ramadan? Absolutely not. It's a blessing in itself that, it's a reset button for us to be able to take all the benefits that Ramadan offers in terms of fasting, in terms of spirituality, in terms of extra prayer, in terms of forgiveness of our sins, and take all of that and then, just be encapsulated in that during this time and ask for forgiveness and, of course, and hopefully ask for protection from any of these diseases. And then, of course, take this time to be at home and to use the foods that we eat to hopefully help us prevent a lot of the diseases that could possibly be coming or that we already have, right? So it's a great opportunity. Do not think of it as, oh man, it's a wash off. I'll wait for the next one. This one's not going to be the best one, but it can be the best one, and hopefully will be the best one for a lot of people.
Dr. Saab, it's very refreshing to hear, from the medical side, how you're incorporating Allah subhanahu wa ta'ala and the importance of ibadat and that one-on-one ibadat, because we've been talking about it for so long, but then, when someone from the medical field is saying that, I think it's reassuring, and it should be for the viewers. So, mashallah, it's very, very good. I guess the questions are coming, so you've probably encountered all of these questions before, but inshallah, I know it's not going to be a hard task for you, alhamdulillah, with your knowledge. Is there, what do you think is the best way to, or meal prep, or etc., or what should we be eating during Sahri? One of the brothers asking, to keep that energy level throughout the 12, 13, 14 hours of fast.
Right, absolutely. So I think we should always kind of make sure that we base our choices around the sunnah foods, right? So people who have attended the lecture in other previous years, they know a lot of these foods. But again, everyone knows that dates are a superfood for suhoor and for iftar. So as far as what someone, just for his specific question, just for Sari, I'll answer that. And of course, I'm sure we'll have more questions down the line for the other stuff. So I'll answer just that for now. For Sari, I think it's really important that you do make sure that you are well hydrated. And so drink enough where you feel like you're not thirsty, right? Don't overdrink, hoping that, you'll be able to somehow store it like a camel. Drink enough that you feel like you're not thirsty and you feel, well hydrated. The way you feel you're hydrated is basically like you feel moistness on your tongue, your nose is not dry, your eyes are not dry, your skin feels okay. That's how you know you're well hydrated, right? And of course, you have good bowel movements. Those are all the signs that you can kind of look towards to see how much water is enough for one person. And then the second thing, of course, would be for longer energy that someone wants is fiber, fiber, fiber. And so a lot of people stress on protein as if it's this magic thing that everyone's always building muscle all the time. It's not the case. Protein is necessary, of course, to rebuild a lot of our tissues, but we get a lot of it in our food already. Very few people are actually protein deficient. Mostly, a lot of people are fiber deficient. And so fiber is in lots of things. It's in fruits, it's in vegetables, it's in whole grains, it's in legumes, it's in, again, beans. It's in so many foods that we already have in our diets. We have our whole grain rice, we have our dals, we have our, like legumes, be our beans, and then we have our fruits and our vegetables. But those are sometimes pushed to the side. And people have kind of more so gone towards, the meat heavy foods because of the protein, or the fat heavy foods because I think that'll take them a long time. But again, switch more towards the whole food plant based meals, which is fairly simple, right? Granola with cereal, or if you have some brown rice or whole grain rice from the night before with whatever vegetable curry that you have. A good bowl of fruits, be it berries, with whatever seasonal ones are available to you. Some vegetables, be it cucumbers, carrots, all of these things. If someone were to eat this in sahur, absolutely they have no issue with energy at all. They'd absolutely be able to last the entire day, because imagine all the nutrients you're giving your body, the fiber you're giving it. It's able to hold on to that water, and then of course the healthy carbohydrates that are in there, because they're all so slow absorbing. You don't have that huge spike in insulin. You're able to actually have a longer duration of energy. So definitely oats are a power food in suhoor that I use personally. Oats with with some dates, and then you got some fruit, and then make sure you get your greens in with a little bit of light salad or even some sliced up veggies on the side. Good amount of water, and again, you see right here, I'm focusing mostly on these whole foods. There's very few like meats or oils that are in here because we don't really need them in the morning that much, right? We want long-term energy. We don't want these spikes. We don't want to feel drowsy for the rest of the day. And so stick with the whole food, the sunnah foods, of course. You have the honey, you have your dates, you have your pomegranate. Uh, I would always recommend plant-based milks. So all those things that if you incorporate them, absolutely, you're gonna have no issue, inshallah, sustaining your energy throughout the entire day.
MashaAllah. Um, this next question, Dr. Saba, is a brother who suffers from thyroid issues. What foods are good for
Mhm.
thyroid patients in Ramadan? The male side, it's a brother that's asking.
Okay. So for thyroid, you have two different camps. You have either someone whose thyroid is very active, which is a gland right here. If it's very active, and then they feel hot all the time, they burn calories excessively, and they're always hot, they're always sweating, and then um, their thyroid is very, very active. So and the opposite you have is someone who has an underactive thyroid gland, which is quite common in our community or in the entire population. And that is where basically someone is generally lethargic, they put on weight easily or they don't lose weight easily, they get pretty cold, their skin might have some changes, they might have a swelling over here. But that's the majority of people that I've seen at least are have an underactive thyroid. And so again, I think the best service I can do for someone would be to actually explain to them what is happening in their body, because that gives them power. I mean, what's happening here and what is causing my symptoms, and how can I then use that knowledge to be able to hopefully, keep this at bay or even reverse this or even make sure that I'm doing the right things for this. So with underactive thyroid, you essentially do have something that's going on that is causing that those antibodies, some inflammation in your thyroid that is not able to pump out the right amount of the hormone that is necessary for every single one of our cells. And so if you think about it that way, something is going on, some kind of insult is happening here, be it antibodies, be it inflammation, be it genetic, something's happening, right? And so all you have to really do is, if you got the root cause of it, which would take some time with your medical practitioner and figuring out, of course, your medication. So, sorry, one tangent is make sure that your medication continue, right? So if you're hyperthyroid, make sure you have your medication. If you're hypothyroid, continue your medication. I'm talking about the foods that you can do to help you along the way. So anti-inflammatory foods absolutely are going to benefit both camps. The anti-inflammatory foods are the ones I just talked about in the last question again, were the sunnah foods as well as the whole foods that are plant-based. And rather than talk, and then of course we have our berries. We have our basically all fruits, but the berries are a power food in terms of anti-inflammatory. And then of course we have our I'll talk about the things that are pro-inflammatory, so you can stay away from them. Maybe that makes things a little easier, right? So what do you stay away from? Again, it's pretty simple. The processed oils, the hydrogenated oils, the snack foods, the heavily smoked or overcooked meats that we have, um, and then of course the dairy. We know now, it is very, very inflammatory. 65% of the world population is intolerant or sensitive to dairy. So cutting that out is a big thing. I think like a lot of people who have these chronic diseases, if they were to just try that one thing, if you just listen to one thing I said today, and you just cut out the dairy from your life with all the processed ones and put it in the plant-based ones, be it the oat milk, the soy milk, the cheeses. If you like the cheeses, use the plant-based versions of those. If you were to just that, you'd be taking a lot of inflammation out of your body. And so, and then you'd replace that with your fruits and your whole grains and your vegetables and your legumes and all these whole foods that are again sunnat, and that are again have shifa in them, inshallah. So if you do just those simple tweaks, and if you understand what's going on in your body, no one is deficient in a little tablet that they get, right? You haven't had that your entire life. That's just there to help you and keep those symptoms at bay. You gotta look at the root cause of what's actually happening and why are we having these symptoms, and how you can take that into your own control, right? Don't think that you're gonna be cured in 5 years by taking a tablet every single day. No, you gotta go to the root cause and see what's causing these things and what you can do personally to be able to help yourself.
So Dr. Saab is telling you all the good stuff don't eat. No, so no, all jokes aside, it's very important. But that same brother just messaged again and
Mm-hmm.
asked in regards to his medication, because you were mentioning medication, when should they take their
Mm-hmm.
medication if they are fasting? So should they take it at the time of sahur, because obviously there's a gap, they're saying of 30 minutes that they need, or is it
Mm-hmm.
at iftar time?
Is this brother the thyroid patient or the diabetic patient?
No, no, thyroid.
Thyroid patient. Okay. So for thyroid patients, usually the way that I'm assuming he's hypothyroid most likely. So the way the medication usually works, it's just a replacement for the normal hormone your body already creates, right? So your body is low on that hormone, so you take it once a day, and it's able to kind of keep you at base, so all your cellular functions are able to perform normally. So if this brother wanted to take it whenever he is the most active, right? So if he's going to be, for the most part at home the entire day, which most of us are, and kind of like, doing most of his activities during that time, then the best time would be before suhoor, right? But if he's someone who is possibly working a night shift even during this time, if he's an essential worker and he's going to be doing most of his activities, during the nighttime, then I would say definitely after iftar, so that the hormone is there in his system to be able to help out all the cellular functions that he needs to do.
Okay, mashallah. We got a brother because you mentioned you mentioned stay away from milk.
Mm-hmm.
And this brother says, I love ruafza. So how much calorie
Mm-hmm.
is it really in a glass of ruafza, and is it healthy?
No, so I would actually uh, I was prepared for this question because I know everyone loves the rubza. So the easiest thing you can do is, I'm not telling anyone to stop eating your favorite foods, right? Um, Absolutely, we can still enjoy a lot of these dishes. But what I'm telling someone to do is that in today's day and age, when we have so much knowledge, so much new information that our parents and our ancestors did not have all this information, right? And again, the food system back then was different, and the foods were different as well. So if we know all these things now, it's kind of it's irresponsible for us to not kind of take some action. So we can still have the foods we enjoy. It's just do a quick Google search, or even just shoot me a message, and we can work together to hopefully find you some good meal plans. But do a quick Google search on how you can make this plant based. So if you love ruwebza, this as you walk down Walmart or Snowfield, whatever grocery store you go to, you'll see a huge section now insurgents in these plant-based milks, and they look the same, they taste the same, they're fortified with the same nutrients. They have actually a lower calorie density than even the actual dairy milks, and they're anti-inflammatory. There's no inflammation with them. So what's not to like about them if they taste the exact same thing? You don't have to have the milk just because you've had it forever. There's a better alternative, a safer alternative. Why not go with that? So I would say pick up a plant-based milk. You won't notice the difference at all. If anything, you'll like it even better. And then for the rubza, actually, yes. Get the actual ruafza syrup that you have. Measure out the actual serving size, be it a tablespoon. Put that in, and then enjoy that. It's a small little treat, and once a day, it should be okay if it's in moderation, right? But don't think that you have to have an all or nothing mentality. Still have some of your favorite things. Just make them more responsible and more in a smarter way, so that you can actually help your journey towards fitness and towards healthiness, rather than inhibiting it every single time that you have iftar. You're loading yourself with sugars and added oils. Think of a smarter way. So I think I'm not sure if another question regarding oils, but I'll mention it right now. If you want to again have fried things, there's a we know we have now multiple different options. Rather than frying, you can still bake an item, you can still air fry an item. You'll get the exact same crunch, the exact same taste. But what's the point of having that 400 or whatever milliliters of oil that's going right into your arteries, right? For lack of better terms, yes, there's a longer way it goes through to your intestine, to your liver, and has different functions. But for the most part, if you think about it, if someone's eating oil, it's being stored somewhere, right? Either in your adipose tissue, in your fat, or in your arteries. So why not avoid that? Still have your delicious samosas, whatever it is, the fried foods, bake them, or air fry them, and you still get to enjoy them without having any of the deleterious health effects.
MashaAllah. There's there's all these other questions in regards to food specific, but a brother just asked. He's diabetic. He
Hmm.
has to take medication 3 times a day, but he wants to fast. So, from a
Hmm.
medical perspective, what would you recommend on food that will kind of last him throughout the entire fast?
Right. So I remember actually in our last two talks, the last couple of years, we had this is a major topic, right? And I had a huge, like 4 or 5 slides on this regarding diabetes and fasting, and then I had the Islamic aspect as well. I even had the some of the hadiths and some of the ulama and stuff they actually said about this. And so I would say my recommendation would be if someone is, a actual diabetic and they are prone to different dips in their blood sugar levels, that can be a lot more dangerous, and a lot harder to manage unless someone is very, very, good at managing their medication timing and their food timing, and their hydration. It can easily go ARI, right? And we've seen it go ARI as well. So I would say look into it real quick. Ask some of your ulama, ask some of the scholars, because there are methods that you can do. Some expediation methods. Giving a hadiah to be able to make up for your fast if you're unable to. So I would say that's something that definitely needs to be discussed with your primary care physician. If of course you can't go in to see them right now, I would definitely say give them a call, and because they know exactly what medication you're on, what your timings are, what your previous HbA1c levels have been. Have you been controlling it well, or are you not controlling it well? What are your other comorbidities? What other diseases do you have along with this? And so that all comes into effect because diabetes is a multi-system disease and it needs to be managed as such. So the Islamic side is pretty clear cut there. That for the most part, if you are unable to manage it, you can definitely forego fasting, and you're allowed to give a nominal amount of money to make up for that. But if you do still want to do it, I would say definitely reach out to your PCP and make sure that you guys are on the same page with a proper plan in place. And then again, a plan in place that if something does happen, what do you have to do to make up for that, that low blood sugar, that high blood sugar, so that you're fully prepared and you're not just, okay, what, I can do it, I can manage this myself, and then going into it, and then, having these issues pop up during this time, especially when already, the healthcare system is so taxed. You don't want to have to again go into hospitals and have to deal with all that. So I would say definitely have a plan in place. You have some days. We have a couple of days. Till Thursday or Friday. So definitely get on the phone with your PCP and make a plan if you want to do it. If not, then there is an excuse for you, inshallah.
Inshallah. The same brother was asking, is it okay to have dates for iftar if you are diabetic?
Hmm. Yeah. So again, if someone was here in my last couple of talks, we had a huge amount of information about fruits and diabetes, and I went into a lot of the studies that we've seen. We have new information now, new science that fruits are not bad, right? Fruits inherently, the sugar in them that we see, the sugar is not the same sugar you get from a teaspoon of table sugar, or like a juice sugar. It's processed differently in our gut. It's processed differently by our bodies, by our livers. There's so much beneficial um, stuff wrapped around that sugar that your body uses to be able to actually help you. And if you don't think of food as um, you know protein, carbohydrates, sugars. That's more of the scientific method. Think of it as a information to your body. It's genetic information. Every time you eat some kind of food, you're changing something in your gut microbiome, in your genes, that you're allowing your body to either heal or to either be inflamed. So again, the date is a sunnah food, absolutely. So there's no harm in it. I would say again, everything is in moderation, right? So you can't have 40 dates or 15 dates and be like, it's a sunnah food, I'm good to go. Have it in moderation, right? But again, as long as you're not, you're staking more mostly towards the whole foods, and having some dates, and having not all the processed oils and other processed sugars, then those of course are going to have an effect on you, and the dates are only going to compound on that. But again, if you've kind of switched yourself now mostly towards a healthful diet, and you're having some dates, even if you are diabetic, then absolutely, that in the long run, it will help you because it's not inflammatory, and it will allow your blood sugar to relatively be stable, because it's usually eaten with other whole grains, right? It's not, you don't just pick up 4 or 5 dates and eat them yourself. You have them with whatever your small amount of oats, or your small amount of your rice, or your chapati later on while it's still in your stomach. So it all acts together, right? So you have to kind of move away from thinking of food as just like sugar, protein, carbs, thinking of like this food as a whole, how is it going to affect me, right? And for the most part, we know how things affect us. We're smart in ourselves, right? So we know a fruit is good for us. We know a date is good for us. We know that samosa isn't that great, but one is okay. So trust what you know for the most part, and don't fall so prey to okay, oh man, this has this much sugar in it, and I can't have it, become diabetic, bananas and all this stuff. I'll reference that study I was talking about that we actually took a group of diabetics and we actually divided them, not me, the study divided them into people who got massive amounts of fruits per day, people who ate the regular diet that they already ate. And we saw that at the end of the study, the end of 12 weeks, that the people who ate the most fruit, like huge amounts of fruit, there was not only a decrease in their HbA1c levels and in their which is their sugar control levels, we actually saw an improvement in it. So, and the people who did the same what they already do stayed the same, right? And so it is beneficial. We have science backing it up. If you want to fact check me on it, you can look up the Physicians Committee for Responsible Medicine, PCRM, or you can look up nutritionfacts.org. These are both organizations that have all the research listed for you there. So again, we have new science now. We know new things, and we have to update the way we've done things. So don't be afraid of the whole foods and natural food that you've been eating for so many years. Don't be afraid of them. Absolutely incorporate them in your diet, even if you are diabetic.
Dr. Saab, can you reiterate that only one samosa?
Yeah, I would say even if it's two samosas, it's fine.
Because
Yeah.
that's gonna be
No,
a
but
tough one, Dr. Saab. Like, I'm not gonna
yeah,
lie.
no, even if it's if you want the samosas, have them in moderation. Just bake them or have them be air fried. Absolutely, there's no reason for us to sacrifice on the things we like, right? Because we still want to live. So absolutely, still have things you like. Just be smarter because we're a technologically advanced society now. So why not transfer that into our foods and the way we prepare our foods? Why still stay stuck in the in the old ages, right? Where we just cook over a fire and dip it into oil. We have so many ways we can do things now.
No, mashallah. It's just something new for people. So I mean, it
Yeah,
gets to that.
it takes time.
um, yes, absolutely. Dr. Saab, this brother suffers from a lot of headaches,
Hmm.
and they don't know what the cause is. But every time it rains or snows, they they get constant headaches and migraines. How can we
Hmm.
prevent that during the month of Ramadan? They also feel it during the month of Ramadan throughout maybe, I guess,
Hmm.
the last 2 hours, their head starts pounding. From a healthy perspective,
Interesting.
what would you suggest their suhoor and iftar be?
So I would say, hopefully they're already being treated or managed for that condition because, again, headache is such a broad term. It can be caused by so many different things. If he already has a migraine diagnosis, then I'm sure he's on some medication, or on some certain protocols. But if he's not, I would definitely say to him, again, get on the phone with your PCP because they are still able to help you, right? They're not only dealing with just COVID right now. They're able to help you and help you manage these things, of course, through the telemedicine route, which can be very helpful. They're able to, get a lot of history from you and talk to you because they already know what you're on. They have your whole chart there on their laptop screen, what you're taking. So they can definitely help you. So I say the first thing, get on your phone with your PCP, make sure you have a plan in place to manage that. And as far as just the food aspect of it, I would say that headaches, for the most part, we know that they're caused by, again, somewhat inflammation, and we think of sometimes of like overactivation of nerves or a increase in blood flow. So many different theories that we have for headaches. So again, I would say that hydration is key. So as long as you are well hydrated, the cells are going to be able to function, whatever issue they have with them. As long as they can function well, it'll keep some of those things at bay. A lot of people are dehydrated in Ramadan because again fiber is deficient, not protein. Fiber is deficient, and again water is not absorbed as much. So get the fiber in, get the water, and stay well hydrated. That's the first thing you can do. After that, making sure that anxiety and stress is also kept at bay. And then if you have any other issues, any other things you're dealing with, make sure those are also being managed. But as far as foods, I would say that we know that berries are very helpful in actually uh, mitigating some of the symptoms for migraines and for headaches specifically. And we also know that to avoid processed foods because they have been shown to actually make the symptoms worse. Like even if you were to Like for example, if someone were to have a huge piece of cake, they'd notice that they actually have a headache later on a little bit, in at least in somewhat, right? So minimizing the stuff that you know is going to just push you more towards the symptomatic side, and in taking more of the things that you know are going to help you more towards either keeping it at bay or maybe even preventing it. So I'll say that, as I could say, from the food aspect, but definitely make sure that you're on a regimen to actually keep that under control.
MashaAllah. One of the brothers, well, we'll get that. This question we'll get to towards the end. Inshallah, it was more
Okay.
personal towards you. But if we were going to say, so another question arises, if you were, I know you mentioned suhoor and what you would eat in suhoor. How about
Mhm.
iftar? What would you suggest a good meal, healthy, balanced for iftar?
Right. So think of iftar as every single one of your cells are completely ready to absorb whatever you give them, right? During fasting, we have so many different enzymatic and molecular processes that are ongoing that our body's using to keep ourselves, alive, basically. And once you break your fast, it's ready to absorb anything. So I would say for iftar, a general guideline would be very first thing, water and dates. And then after that, if that's even enough for you, just to kind of like you let your body kind of digest that initially to be okay, and then maybe pray namaz, and then come back towards the rest of your iftar. I would say after that again would be a good amount of fruits right away, and then get some veggies. So that's like your right away, no matter what. Like before you even eat anything else that's on the table, which is still okay. Get those in because your body is going to start right from your tongue. It'll start releasing certain enzymes and certain molecules that are already starting to digest those things, and so it's ready. So if you give it those great nutritious things right away, you'll be on the right path, and so you kind of bracket it with healthy foods. And so then after that, it's good to for iftar to keep it relatively light. Again, you don't need tons of protein because you're not deficient in protein. You didn't just have a bodybuilding session where you went and you destroyed all that protein. You don't need that much. Keep it more so on the whole grains, the stuff that's going to have you again a longer energy source. So your whole wheats in any form, whole wheat in any form, your whole grain rices, your brown rices, your oats, and then you have any of your nuts, your legumes, your beans. Again, these are all be made into different curries, or they can be made into different salads. They can be made eaten by themselves. So I would say a good balance will going to be some kind of whole grain, be it like chapati or a small amount of oats or some rice or some whole brown rice, and then maybe a curry. In that curry should hopefully have some kind of like some legumes like a dal or like a bean. And then again, you want to have some veggies in there and some protein. Hopefully, if you are a meat eater, you can have a small amount of protein. I wouldn't really recommend it, but if and then of course some veggies, and then of course you have your water and your fruits and your dates, and that's an amazing iftar right there. The general guideline right there. If you kind of follow that, you'll absolutely be set, and you should hopefully be good enough till dinner until maybe your late suhoor. And again, I would say even then, follow the exact same guideline. There's nothing wrong with it. You're helping your body along to keep it nourished. So whatever kind of whole grains you like, be it naan, chapati, be it your pita breads, whatever kind of stuff you like, as long as it's kind of whole grain, stick with those. And then your protein sources, you have lots of protein sources, but keep them within just a fist size. Don't have too much. Whatever protein you have for that one meal, it should be fit within your fist. And then your veggies, you can never have enough. Fill up on them, whatever you like, be it in your salads, be it in your cut up vegetables, be it in a curry. And just get those veggies in. And then your fruits, make sure you have a bowl of fruits, even if you're diabetic, non-diabetic, whatever disease you have, it will not harm you as long as you are not, going crazy with other processed foods. The fruits in themselves, don't be afraid of that banana or that other stuff because you're diabetic. It's not the issue. That's not the cause of your diabetes. So definitely stick with those, and then you can play around however you want. You can add many different curries in there, many different types of meals in there. Yeah, as long as you stick to those general guidelines, you're gonna be okay in every single meal that you have. But don't and if you want, again, those treat foods, our samosas, our pakoras, our other things, absolutely have them. It's a time to enjoy and time to share with your family. So just prepare them in the method that I recommended, which is either baking or air frying them, and you should be good.
So, Dr. Saab, you make a very good point about the fist amount.
Hmm.
So, in terms of plates, because I know in previous sessions that I've had with you, you've mentioned
Hmm.
because you'll have certain amount of foods, and then you just second plate, third plate, fourth plate. So
Yeah,
if you can reiterate
yeah.
that, please, for the viewers.
So I have a rule basically. If someone were to go to a buffet or to a dawat or to a party, that I had the one plate rule. That you're there to enjoy and go for it, but only one plate. You're allowed one plate of whatever stuff you like, and then after that you're done because you've already had for sure enough calories in that one plate. And that was kind of the rule that I had, or the allowance that I had for people, once they're at a gathering. But now once you're at home, there's no reason to absolutely engorge yourself like that. I would say now you can spread that out. The foods you like, the food that you guys prepared, you've been looking forward to those foods. Spread them out. Have some at iftar. Have some as in the middle of the snack. Have some again, with dinner with suhoor, and then because in the middle you're still active, you're still moving, you're still praying your salat hopefully, and then you're hopefully playing your tarawih. So all that adds in because you're not just engorging it all at once. You're spreading it out, and it's been prepared in a relatively healthy manner.
So, mashallah. Dr. Saab, a brother is asking that when he eats, it all goes to his stomach. How can we prevent that with exercise, and what type of exercise would you recommend for Ramadan?
So it sounds like it's a very, very common concern because it sounds like he's feeling bloated essentially, right? Our stomach innately has it's like a flat sack of a muscle, and when you fill it up with water or food, it's a muscle. It starts expanding. So usually the 1 liter is the time when it's able to actually send a signal and say I'm full, and it takes about 20 minutes for that signal to get from our stomach up into our brain, the hormone. And so again, if you eat relatively slowly, which will hopefully allow that signal to come and allow you to feel less bloated, because eating within 5, 10, 20, 15 minutes, you're going to feel so bloated because that stomach has gone past what it usually does. The stomach, again, is a muscular sac. It can expand up to 4 liters. Those huge jugs that we see that we get from Costco or Walmart, the stomach can get that big if you wanted to. So you got to be careful. So eat relatively slowly, chew your food a lot, eat slowly, and then again incorporate those general guidelines that you have there. Even if you aren't following them, if you eat relatively slowly, the issue of bloating will definitely be minimized because a lot of the bloating we get is from the inhaling of the carbon dioxide and the gases that we have around us. When we're eating so fast, we also inhale a lot of air, and so that causes even more distension. And again, this I want to bring it back to the sunnah because the Prophet ﷺ, people know the sunnah about the 1/3, right? Fill your stomach with 1/3 food, 1/3 water, 1/3 air. But people know that that's only if you want to eat, right? If the son of Adam only requires a small amount of food. We don't have to always eat the 1/3. We require just a small amount of food. The Prophet ﷺ, but a lot of times he would just have water and dates for iftar. And that is the best of all creation, the best of all mankind, and that's enough for him. So why shouldn't it be enough for us, right? We're blessed that we're able to eat such amazing foods, and we're able to have these issues of what kind of food can I not eat. But really, we don't really need as much as we think we do. Use this time again to tap into your spirituality. And you know what? I want to be able to hopefully move away from all these issues. So hopefully move back towards the sunnat. And so I would say for that brother who kind of wants to avoid the bloating, I would say chew a lot, eat slowly, keep drinking water in between, and then give yourself about 20 minutes. So once the 20-minute mark hits, you feel like you're relatively full, then you probably are. If you feel still really hungry after that 20 minutes, then yeah, your stomach hasn't expanded that much, and you can still probably eat a little more, and you should be okay after that. That's what I would say to him.
MashaAllah, Dr. Saab. I love how, for the viewers, how they're incorporating the religious side. MashaAllah, Allah preserve you and, gave you more knowledge and towards how you can incorporate Islam with your practice, MashaAllah. Another brother was asking, he's urging, because he wants to get in touch with you, if you can share, I don't know if you want to share with everybody, but I mean, it's up to you, how they can contact yourself for just general advice.
The best would be email, right? And then once we have we're contacted through email, we have any of the platforms that he wants to use. We can make contact through there. But yeah, email. If you want, I can send it, and then we can have it up on the screen if you want.
Yeah.
And then they can contact me through there, or even if they want to look me up on my Instagram page. Again, everything. Even if they just Google my name, you don't even have to. You just Google my name, Dr. Muffaqam Shah, and you'll find all the ways to contact me: email, Facebook, Instagram, Twitter. Anywhere you want to reach out, I'll be able to reach out to you. So probably the easiest way would just be Google my name, because I don't think many people are named the same as me.
No, mashallah. So for the brother who was asking, Google the name, Dr. Saab's name is there, Dr. Muffaqam Shah, and then you can contact him via the social media platform, inshallah. We have two more questions, Dr. Saab. I know we've taken a lot of your time.
No, absolutely.
But we're going to have to backtrack because his brother has now sent it about 4 times about COVID-19. So if we can
No
touch on
problem.
that, and then I'll give you one last question in regards to healthy Ramadan. Another brother was asking. So we'll go to COVID-19 because he's urging for this question. How about if someone who's been cured of COVID-19, can they still transmit it to someone else?
Great question. So again, we have to go to the literature, the data that we have from the scientific articles, right? So we know that once this virus enters a cell, again through the mucous membranes, your eyes, your nose, your mouths, um, once it enters there, it goes to the cells and it goes into the bloodstream, where then it goes through the entire bloodstream and the lymphatic system, and that's how it affects us as a whole body level. So that's how it affects us. So if you can imagine that once the immune system is done fighting it, and it's kept it at bay, and it's not so bad anymore, that the symptoms are done, right? So again, now you got to imagine that it's still somewhat replicating in those cells, right? Maybe it might be not in the millions, but it might be in the thousands, right? So it's still somewhat replicating in those cells that you have all of your body, your mucous membranes. So even as I'm speaking here, I'm releasing some kind of fluid here. So you should definitely be safe that even if someone has recovered from the disease, we do hypothesize or believe or have some preliminary evidence that there is a chance that they can still possibly transmit the virus, possibly. But again, there's no concrete data yet, right? Because again, this is all new. It's only been a few months, and we have to see data saying that, hey, like this patient got it from this patient, and then we have a huge set, and then we can say yes, it's definitely possible that someone is still transmitting this. But in the meantime, just be safe and just again go back to the way I explained it and think of the actual mechanics and the science of how it works. Right? If you think at the basic level, that yeah, it is possible. So why not just be safe, right?
MashaAllah. Dr. Saab, I think you've given us a lot to kind of absorb. And before we conclude, and before I ask you to kind of wrap up both scenarios, the biggest thing was we were planning this. The biggest feedback we got from years past is do it before Ramadan. So now we did it,
Yeah.
and we're in COVID-19. We're in COVID-19 because, mashallah, it's one to see is the way that you do your PowerPoint presentation and stuff like that, and you talk about your personal life as well, which I think people unfortunately don't get to see this year, even though we planned it right this time. But
Yeah.
inshallah, next Ramadan,
Inshallah.
we can do that, inshallah. So I'll go to the last question from a brother. How do you maintain a good, healthy balance in your weight for throughout iftar and stuff like that? Because some brothers, they'll have their suhoor, read fajr, and then go to sleep. So all of that kind of sits. And then iftar, whether they read tarawih or they don't read tarawih, they eat and then go to sleep so they can get that sleep in. So how would you say to help maintain that balance?
Yeah, absolutely. And that's definitely something that can be, of course, answering his question, but for every single person listening, everyone wants to, for the most part, maintain their weight, right? No one wants to be able to, balloon up during this time. And so we should bring it back to the fundamentals of how, our body uses food, right? So when we're out about in our day, we're working, we're out and about, we're burning lots of calories because we're walking, we're breathing, all our cellular processes are happening. So stuff is being used. So during that time, of course, it's a lot harder for fat to be stored unless you're eating, a very, very type of inflammatory types of food that can be stored as fat. But now during this time when we're all kind of, quarantined for lack of a better word, and we are, for the most part, again, working from home or just making small trips, and our activity level has substantially decreased. So yeah, think about it like that. You know what? The food I was eating before, it's not really going to work out now because I'm not as active anymore. So just take it back to bring the portions down, planning your meals out, and again, giving yourself time, making sure that you're not just eating because this is how much you used to eat. Listen to your body, see how you feel with that certain amount of food, and after which you can modify it. You can eat more or do you need less? That's one thing I would tell them to do. After that, the second thing would be why not use it as an opportunity to actually increase that energy level, right? So of course we can't really go out for huge, long walks because that's not social distancing. But if you were just maybe walk around your house, do housework, the non-exercise associated thermogenesis, NEAT is what we call it. So if you have a high level of NEAT, we've seen people who are relatively thin. It's not because they're amazing athletes for the most part. It's because they have a high NEAT level and they're always for the most part active. They're not really like sitting or sleeping. They're always doing something, and that burns a lot of calories throughout your day and throughout your week and throughout your month. So you can imagine that that adds up if they're always doing that. And so I would say stay relatively very active. Don't at least for me personally, I try to not sit as much as possible. I try to go out and do things and walk around. Any activity you have, any opportunity you have for an activity, go for it. Do it around the house, help around, and then that's number one. That's neat. After that, yes, exercise wise, we can actually incorporate exercise into Ramadan as well while we're at home. There's a great website or a business that I love to promote is called Amana Fitness. You can Google them, AMANAHfitness.com, and they're a fully Muslim business, and they're all about helping you with your fitness and with your eating, with your spirituality, and especially during Ramadan, they have tons of programs for you, tons of free ebooks. That can help you with your exercises. But I'll just summarize some of the stuff that they're talking about in terms of exercise. They recommended 6 different times. So they said either before suhoor, or right after suhoor, right before iftar, after iftar, or again in the middle of the night. They said those are possible times. So you can pick whatever time works for you and make sure you're well hydrated. All that stuff is there, of course, when you should be hydrated. But the exercises you can do are all at home. The best weight we have is our own body. So if you can just again go on that website and find some of their stuff, and it's for any age group, any physical fitness capability, anybody can do it. It's not you don't have to be out there running on your treadmill or on your track or weightlifting. Just stuff at home with the things you already have. Without any equipment, you can absolutely get a good like 5 to 10, 20-minute workout wherein you've challenged those muscles and now they need it. They need nutrition and they'll get that from the food you give them, and then they'll use that to build muscle, and that's how we maintain our physiques or maintain our weight. You don't want to get in the trap of what, I'll just keep eating less and then hopefully I maintain my weight, because then your body will adapt, right? You want to keep challenging your body and make it do some things that it's not used to, which is what exercising is within your capability, right? Getting better every single day. And then what the body does is it'll adapt, it takes some nutrients, and it'll increase your metabolic rate, which is how many calories you burn. And if you do that regularly, then that's how you stay relatively fit and you maintain your weight for a long period of time. So I would say for that, brother, absolutely make sure that you increase your NEAT, try to exercise during those times. It'll be laid out very nicely in that website if you check them out, amanafitness.com. And then of course control or modify the amount of food that you eat, because be cognizant of how much you're putting in, how much you're actually putting out.
Well, it's a very good. So the brother that was asking it, amanafitness.com. As well, if you need more information, you can contact Dr. Saab. Google him. That's the best way. He's known,
Google me.
Dr. Muffaqam Shah. MashaAllah. So, Dr. Saab, if we were to wrap up in the sense of your kind of final message, your pagham in regards to COVID-19 as well as healthy Ramadan, if you can sum up your discussion as your final message.
Sure. So I would say we are in a very unique situation for our generation. This is absolutely trying times, but it doesn't have to be, a punishment from above. It can absolutely be a great opportunity for us to better ourselves spiritually, mentally, physically, emotionally. It's absolutely an opportunity for us in all aspects. So first things first is a change of mindset, that use whatever you have around you to better yourself, right? And then the second thing is Ramadan. With Ramadan approaching, it's another opportunity again for you to just better yourself, right? So absolutely take it as an opportunity and not as a negative or a punishment. Use the best resources around you. We have the internet nowadays. It's amazing the stuff you can have coming straight to you, information, help, reaching out to people. You have so many things at your disposal, right? On your phone, on your tablet, on your laptop. that you can use right now to absolutely, better yourself. So think of it as an opportunity and use it to the best of your ability, and you will come out, stronger and better. And you're gonna look back at this and feel like, that was our best Ramadan ever, inshallah. And as far as summing up the COVID situation, I would say that we the things that we've been doing have been working. This is why we're seeing, the stagnation and the number of numbers. It haven't had a huge increase, right? The graph is kind of plateaued for the most part. So we have to continue doing those. They're there for a reason. Again, if you want to go back and listen to the beginning of this talk, where we talked about how it actually spreads and the mechanics and the science of it, just so you can kind of get a visual representation of what's going on and why we need to do those things. It'll really help you understand, like, what, we have to continue doing them so that we can actually be on the downward trend and then hopefully get back to some sense of normalcy in our lives. But again, use it as an opportunity, right? You are at home, you have so much more free time. All the stuff you said you wanted to do because you didn't have time to do, start doing it now, right? All the people you want to connect with them now. So again, use it as an opportunity. Make sure you take care of yourself, mentally and physically and spiritually, and don't let this chunk of time go to waste and be like, you know what, I'm just going to keep my life on pause and then we'll see what happens once all this is done and I can get back to regular life. No, use it as opportunity to to fulfill and better your life.
MashaAllah. Dr. Saab, beautifully done as always. I always enjoy it because I sometimes add in my personal questions and,
Yeah, no problem.
and stuff like that. So from our team to you and your family, we wish a happy Ramadan, a safe Ramadan, and we
To you
wish
as well.
that you guys stay safe on the health side as well as in the month of Ramadan. And I want to thank you because you are a frontline worker and what you do, and you put your life and your health at the risk for the betterment of others, from our families and our team here. We want to thank you for all of your efforts.
My pleasure. Thank you.
And inshallah, next Ramadan, before the month of Ramadan, we're going to do that
We'll do it again.
slideshow,
Yeah.
inshallah. But
Yeah.
thank you very much once again. And our
And
du'as
I'd
are
like to
with you.
say thank you so much to the Sufi Council Toronto, Mecca Islamic Center. You guys have been so kind every single year to invite me back. Right when I basically started, I graduated med school. You guys had me on here, and talking. And that's a great amount of trust you placed in me. And then we've basically grown together, right? Starting off, we had just a mic and a PowerPoint. That was it. And now we've got, mashallah, we're online. We got people viewing. We got questions coming in, and inshallah, we'll keep growing like this in the future.
Absolutely, inshallah. All the best. And again, if you need any support from us, we are here for you and your family.
We will do. Thank you so much. Jazakallah.
Assalamu alaikum. So this was Dr. Muffaqam Shah Saab, mashallah, incorporating obviously his update in regards to COVID-19 and informing us about that, and his take on how we're bending the curve and how we can continue to make this better for the future. And then as well as a healthy Ramadan. I mean, it's unfortunate that we can't do the PowerPoint presentation this year, but inshallah it's very good the way he breaks it down and completes it for everyone, and answers questions according to the sunnah. Mashallah, Allah subhanahu wa ta'ala bless them and their family and give them more knowledge so we can kind of learn both aspects, the healthy aspect from the medical side as well as in part of the Islamic way and the sunnah of Rasulullah sallallahu ta'ala alayhi wasallam. So there you have it, dear viewers, both the male and the female side for the brothers and sisters. Inshallah, please share this before the month of Ramadan, as we are almost a week away or less than a week away. So please share this video to your friends, family, loved ones, brothers and sisters, so they can reap the benefits to make this a prosperous Ramadan, inshallah. So as we conclude, what I will say is there's going to be a short video after we are done here. Please stay tuned. It's about helping the Makkah Islamic Center. So I urge you guys in the month of Ramadan, please reach out and support the Institute so we can better ourselves and we can keep it running and do programs like this for the viewers and the community, inshallah, to build awareness on many different levels and aspects, and we can kind of evolve together and grow together, inshallah, in knowledge. So my dear respected brothers and sisters, please stay tuned for that, as well as next week we have our Ramadan calendar. that's out on all social media. So if you go to Makkah Islamic Center, you go to Sufi Council of Toronto, you go to any of the platforms, please reach out. If you need a hard copy, inshallah, we can try to get that to you. But you can see the Sahri Times. Our donation is also on there on the bottom right corner. And Makkah Islamic Center would like to thank all of our sponsors. There's 8 sponsors, alhamdulillah, that always help the council. And this year they're helping the Makkah Islamic Center. So Allah subhanahu wa ta'ala bless them and continue to give rizq and barakah in their business, inshallah, ameen. So Daily Food Bank, we're continuing to do that. We need your generosity. So please reach out to any of the brothers for non-perishable pickup, as well as for the month of Ramadan, as well as leading up to the month of Ramadan, where we can help families together and receive blessings from Allah subhanahu wa ta'ala, inshallah. So please message us on any social media platforms and reach out. And lastly, our Makkah Islamic Center application, please download it. Go on the Google Play Store and the Apple App Store, Makkah Islamic Center. So please download that. We're going to have a lot of good things happening, a lot of new things happening, interaction with the community, etc. So please stay tuned for that. And inshallah, until we meet again, we ask you to keep us in your du'as, and we will keep you. Jazakumullah khair. Please stay tuned for the video that's coming up. Wassalamu alaikum wa rahmatullahi ta'ala wa barakatuh. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته. My dear respected brothers and sisters, I come to you from the Makkah Islamic Center. I come to you with an appeal to help the Makkah Islamic Center continue running and operating. We are in testing times right now with the COVID-19 coronavirus. And we can all understand with job layoffs, sickness, and just the day-to-day worries of what is going to happen and the worry of the unknown. My dear respected brothers and sisters, we are alongside you in this struggle and in this battle. The Sufi Council of Toronto for the last 3 years has been doing programs, whether in the university sector, quarterly food and clothing drives, working with the homeless, working with troubled youth. And alhamdulillah, we have done this with our own blood, sweat, tears, and money. On March 1st, 2020, we took over Makkah Islamic Center. All of its costs, with the blessed donors and the management team, we have gotten this far. And now we need your help. Rasulullah sallallahu alayhi wasallam in their blessed hadith, narrated by Hazrat Umar Khattab radiallahu an, states that those who help build a masjid with their own wealth, Allah subhanahu wa ta'ala will build a masjid for them in Jannah. This is the ultimate goal, a gift from Allah subhanahu wa ta'ala for us in the akhirah. My dear respected brothers and sisters, we need your help to keep the Makkah Islamic Center running. Our monthly expenses are about $3,500. We need your help in these times so we can build a future for our youth here at the Makkah Islamic Center, where we can teach your kids where the Quran, the Hadith. We can teach them to be good Muslims, good Canadian Muslims, examples of Muslims, so that you, the parents, can be happy. Help us today. On your screen, you have our institution, branch, and account number, as well as an e-transfer, suficounciltoronto@gmail.com. You can also donate via credit card at donate.suficouncil.com. You can call any of the brothers, myself, Amir Qadri, Hafiz Yahya Natalia, Hafiz Bilal Natalia, Mohsin Patel Ashrafi. They're all channels who can come collect money, so you don't have to come out your house. You can donate online with what is on your screen right now. My dear respected brothers and sisters, the Prophet ﷺ states that give with your right hand so your left hand doesn't know what you gave. How many of you, for the sake of Allah, are going to help the Makkah Islamic Center so we can become together a great Islamic center for the future. The time is now, my brothers and sisters. Ramadan is around the corner. Your hearts should be open. Reach into your pocket, reach into your purse, your wallet, and help the Makkah Islamic Center stay alive with the will of Allah and your generosity. May Allah subhanahu wa ta'ala give shifa to all those who are sick. May Allah subhanahu wa ta'ala ease our pain, ease our hardships, ease the trial and tribulations that we are going through, especially leading up to the month of Ramadan. Inshallah, ameen. Jazakumullah khair. Wa akhiru dana wa alhamdulillahi rabbil alameen.